I'm happy to share all of you that our today's meeting is now YouTube live streaming. I'm about to post the link in chat box. Respected dignitaries, respected jury members, and distinguished guests, distinguished speakers, all the participants, and my dear students, a very warm welcome to this auspicious evening of last day of our 2 weeks prolonged international FDP. In this juncture, I'm very happy to introduce our today's distinguished speaker, Professor Dr. Purushottam Krishnappa sir. Sir is MBBS and MD Pathology, and sir is currently from DIPA Park, UK, and sir is IMU University, Kuala Lumpur, Malaysia. Currently, sir is working there, and his executive profile is sir is a senior academic and clinical leader with 22 years of experience in medical education, pathology, and academic administration across Malaysia, India, and MN. Um, Sir is expertise in internationalization, national education, and strategic academic leadership with a strong track record in research, institutional development, and global collaborations. And sir's current positions is hello. Is my voice audible?
Yes, ma'am. Yes.
Yeah. Yeah.
You
Thank
are
you, ma'am. Thank you.
audible.
Yeah. Thank you, ma'am. And sir's current positions are Dean, Global Engagement Office, and sir is professor in the Department of Pathology, School of Medicine, International Medical University, IMU, Malaysia. And he is having a very good previous leadership roles as Associate Dean in Student Affairs, IMU, and Associate Dean Academics, IMU, and Head of the Department, Department of Pathology, IMU, and Associate Dean, School of Medicine, IMU, and Head Division of Pathology, IMU. And sir's education and professional credentials are, sir is having PG Diploma in Medical Education from University of Dundee. And sir is having PG Certificate in Medical Education, University of Dundee. And not only this, sir is having many research and academic highlights like 40, more than 40 publications in peer-reviewed journals, including Q1 Scopus Index journals. And sir is a principal investigator in more than 10 research projects. And sir is having many research funding projects sir had secured. And sir's research focus in AI in pathology, artificial intelligence in pathology and medical education, oncology, biomarkers, and digital pathology. And sir is having many publications and care expertise in strategic academic leadership, global engagement and international partnerships, medical education and accreditation, clinical and diagnostic pathology, research leadership and innovation in AI medicine. And SAR is having many memberships like Royal College of Pathologists UK, College of American Pathologists USA, Malaysian Medical Council and NSR, Indian MN and Medical Councils. And not only this, SAR is a keen motivator and very good speaker. That's why, and uh, immediate after our proposal, sir had given his immediate response and agreed to say a few words on this platform. And we are very fortunate enough, sir, to have you as a distinguished speaker today, as this is a very auspicious day, as we had been listening many talks since last 14 days, sir. This is the 15th day, and it is very auspicious day that we are having you as a distinguished speaker. Thank you so much, sir, for accepting our proposal and invitation. Over to you, sir, for your speech. We are all very delightfully waiting, sir.
Hi, good evening, madam. Thank you so much for that kind introduction. That makes my job simply easier. Um, Good evening, everyone, ladies and gentlemen. As the introduction goes, I first of all want to confirm my voice and my video is clear to you all. It's late evening in Malaysia. It's 8 p.m. now for me, so I'm taking this from my home, not from my office place. If at all I bump into any network issues, please do alert me that I'm not able to reach you. So that I can retune my network. I hope it should not be the case. It's generally the stable network in my home as well, and I should be able to deliver this talk smoothly with all. I'm glad to hear that there has been a faculty development program which has happened 2 weeks plus at this platform, and I'm excited to learn that there's been numerous academic discussions that has taken place, and I'm privileged to have myself in this platform at the last day of the show. I hope I'll be able to do justice in this talk and connect with you all. Though some of the names looks very friendly because I'm also primarily from southern parts of India in my undergraduate training, and I moved on from India to a few countries before I grabbed into these qualifications, and I finally landed up in Malaysia in my current roles. Before I start off, let me bring up my slides, which will help to thrive this discussion in a better platform. Again, if I may confirm if my slides are on to you all, and also it is on a slideshow mode. I'm so sorry, when I'm on a slideshow mode, I'm not be able to appreciate the gestures. If anyone can unmute and confirm that.
Yes, sir. Yes, sir. Your slides are visible, sir. Just move once, sir. I'll confirm whether it is moving or not. Yes, sir. They are moving also.
Excellent. Okay, thank you so much. With that, then no further ado, let me make a start. As it was introduced, my name is Puru. I am from IMU University, Malaysia. I have two important portfolios in my university. One, I'm the Dean International or the Global Engagement Office, and I'm also the Professor of Pathology for School of Medicine. I'm responsible for transnational education in my university. I'm going to explore that along with you in my talk today. So that's been the agenda why I'm excited and met you. And thanks to the organizing team to providing me this privilege to share the platform. The moment I learned the title of the faculty development program, I was equally excited because this is under my portfolio and that's my day-to-day business. And I'm co-learning with you all today when I'm presenting this. So keep this interactive. If there's anything that you want me to elaborate or explore, I'll be more than happy to do that. Or if you thought that you can share your experience into respective context when I'm delivering this talk, I'm more than happy to absorb that as well. So what I'll be focusing today with you in another 45 minutes plus or so is I want to focus on breaking the disciplinary boundaries in medical education. I mean, coming from the traditional medical education myself, how I've been challenged going into interdisciplinary or into professional medical education in respective countries where I studied and then moved on to work. I had numerous challenges that I had to face as a student. And then when I moved on to become a faculty myself, then there's numerous barriers that I have to cross through to break that mindset and then get onto that leadership roles and etc. So that is the way I'm approaching this. Naturally, what I'm trying to do in this session also to bring you the theoretical background as well. What is being there historically being done? Is there any evidence in the literature? So I'm taking that approach and providing you both the theory as well as practical experiences today in combined fashion. But I'm very much reminded it's late evening. I'm sure you have or had a full day like me, and I'm not going to bore you enough. If that's the case, just let me out. Before I move on to give you the scientific part of my talk, I would like to introduce my university with you all. As you're seeing this beautiful campus, we are based in the heart of Kuala Lumpur in Malaysia, which is the capital city of Malaysia. And we used to be called as International Medical University. Now we have rebranded ourselves. We are now IMU University. We are the most and the first private established university under the premium bouquet of Malaysian Educational Institute. We have totally of 6 campuses together. And the first one, what I showed you, is our main campus in the Kuala Lumpur heart city. And we have 3 campuses now nearby in the Kuala Lumpur, and we have 3 more campuses, southern states in Malaysia. A couple of them are in Seremban state and also a deeper down state called Johor Bahru. If you learn that, that's a very close proximity from Malaysia to Singapore. So these are the places that we have our campuses, and we have a wide variety of students occupying nearly 5,000 across different campuses, and we train them for clinical training for various disciplines. So how am I going to deliver this talk? If you appreciate, I'm going to start off to give you some kind of introduction about this cross-discipline teaching learning activities. Later on, what I'm going to do is to move on to touch upon some of these theoretical frameworks. And in later part of my presentation, I'm going to provide you some of the practical examples and methods that I apply in my universities and also elsewhere globally, the best practices. And of course, this comes up always with some challenges. I'm going to share some of the challenges that what I perceive to be important. And with the challenges, I may pose you some amount of solutions and might invite you to provide more solutions that we all can adapt together. And I would end my presentation today with some conclusions and take-home messages. And then I've identified a couple of areas of discussions. In fact, in the recent times, I was writing a paper for the Medical Teacher Journal, and then there was some of the probing discussions which happened between me and colleagues that I'm going to present to you today. We could collaborate and see how best we can improvise the student learning experience. With that, allow me to start my talk, and then I would want to start off my talk emphasizing with the key proposition that I want to make is interdisciplinary teaching or multidisciplinary teaching is not a luxury. It is not something that we want to crave for. It's actually an inherent property of the medical education. As you will appreciate, we always talk about the contemporary medical education in the current field. Now, when we say contemporary medical education, what we mean is we can't escape from the real life experiential learning for our students. If you're training your students to be a healthcare practitioner in a real life experience and you want them to be graduate ready by the time they are out of your colleges, so what you need is to go for the contemporary medical education. When I mean contemporary, all the basic principles of the modern medical education kicks in, and one of those is multidisciplinary or interdisciplinary teaching learning activities. So it's now almost a compulsory thing for us to get into. Now, why is that? As you look through the illustration, what I put in there, that's not something uncommon that we see in a healthcare setting, isn't it? So when you walk into a hospital, you will see that there are departments like hematology, radiology, oncology, but that is not the start point, actually. That's always at the end point. When you look at the start point is always your patient goes to your primary healthcare settings like a GP clinics. They're going to go into the primary healthcare hospitals in which the patient comes out with a problem. So when the patient comes out with a problem, example, your patient comes with a chest pain, and chest pain is not equivalent to a myocardial infarction. So you wouldn't diagnose them and straight away send it to a cardiology, or it would be an orthopedic clinic when you are suspecting a teeth syndrome for your patient. So it's not equivalent to a discipline. Patients equivalent to a diagnosis. That's what we are going to get into. And if it is a diagnosis, it always comes with an integrated approach. So put that into a real healthcare setting. A patient walks into your clinic, then you're going to work through the whole of the patient data in a holistic fashion rather than a piecemeal fashion. At that point, there is no breakdown of the systems into either anatomy, physiology, or into orthopedic, gynae, etc. They all come in an integrated fashion for the simple reason that means your integration or learning should be also in an aligned or a constructive fashion so that your diagnosis is becoming more accurate, which automatically goes into a specific management plan. If that's at one side, the second side is the healthcare itself. So getting a right diagnosis, yes, is the key competency that you look forward in your students, but at the same time, how are your students in future going to give you a great care? It's not just about getting your students to be in a high competent mode. Let's be more selfish. If you and me become more older, and if we want to be in a healthcare setup, we want to be under a genius hand, isn't it? So for that reason, you want your students to collaborate extensively among themselves. You want them to be collaborating extensively between other professionals. It could be anywhere from dentistry to nursing to pharmacy or biomedical or etc. Because this is the team, they come together and to make the healthcare system to a more efficient system where we are going to feel more safer. So that is in the reality mode. If that's the case, we need to bring the match in our teaching learning activities. In my opinion, there's been always a constant friction in the medical education where we try to strike the idealistic approaches where the realities and practicalities are on the other side. And the best bet, in my opinion, is to strike a balance in between. And of course, local context is always a picture where your local context should help you to bring that balance between your two contemporaries so that the medical education strives to the higher level. What I see holistically is this is what exactly I was getting into. On one side, we have all our disciplines, and the other side is actually the reality. Now, I bring that center point of my circle in the slide illustration as the reality. That's your patient system. That's integrated clinical case that we put for our students. But translate that into a real healthcare setting, you have your patient there with multiple issues, or sometimes they might have multi-dimensional disorders. If that is the case, how are we going to train our students to identify them, integrate the whole of the clinical data, translate that into a specific clinical diagnosis, which will dictate the specific management plan? Now, when we teach our students, of course, we come with our own expertise. A lot of us are trained at certain levels. For example, we are specialists in anatomy, we are specialists in microbiology, we are specialists in gynae, PD, etc. So when you are training your students at that level, you are an expert of your subject. So naturally, what you're going to deliver is you're going to deliver your own expertise, which is a hand touch knowledge for you. And you have your magical wand to transform your student into your own expertise as well. But remember, at the undergraduate level, the first thing that you're doing is you're training a GP. So the GP is supposed to be a holistic screener for the entire society. So he's the person who's going to actually pick a normal versus abnormal and then translate that into a hospital setting if it should need to. So what is this departments doing now? The departments are delivering actually chunks of information. Well, at the end of the program, what you expect is you want a learner who is holistic enough, competent, ethical, and of course, is tech enabled as well, because you can't escape AI coming into all nooks and corners of our life. The learner has to be AI efficient as well. So in my opinion, all these are already integrated to one another. It's just that we are using this as a tools to integrate and then deliver the content to our students. With that, let me bring up some amount of the theoretical frameworks that what we see in the medical education, and particularly to the cross-disciplinary learning. There's so many layers of theories can be explained. In my opinion, the prime three layers should be covered for cross-disciplinary teaching learning activities. Number one is epistemological layer. Now, what is epistemological layer? How knowledge is structured. Now, if you appreciate, our students learn and gain information from multiple platforms. It could be from your lectures and a big group lectures, or it could be a small group teaching learning activity like a practical session, dissection tables, or you go into a Viva OC and things like that. So that's how students get trained. But don't you think your students actually behave differently in different groups? For example, if they're in the lecture theater, their cognitive assumptions may not be the same as when they are in the small group sessions. So it's important to know what is that epistemological stance that you're taking for your teaching learning principles. And this is super important when you're designing your curriculum or when you're going for a curriculum reviews. You may want to appreciate that how are your students gaining information. I beg to differ to many of my co-medical educationists when they talk about knowledge versus information. It's completely two different things. Colleagues, you will appreciate information is something now available at the fingertips. So no one wants to remember normal values anymore. If you appreciate USMLE exams, the normal values are usually given away to the students so that they can interpret it straight away. What is knowledge then? Knowledge is the application of information. So our students in my university are experts in gathering information. They sit in multiple teaching learning platforms. They grab a lot of information. In fact, their cerebrum can go hypertrophied. But when you ask for the knowledge, that could be limited. So how are we going to do that? So that's the epistemological stance that I'm bringing in. Number two now, cognitive. The cognitive theory talks about now how does students transform information to knowledge in an integrated fashion. For example, someone talks about anatomy of esophagus. So a student might learn that esophagus could be like 25 centimeter in length. And then they might even add up saying that there's another 15 centimeter above the esophagus until it comes up to the oral cavity. Now, how does this become important for the students? So the first part of information is epistemological. Now, cognitive would be, then the student should relate, I should use a Riles tube of at least 40 centimeter to place into my patient so that the patient gets a nutrition going into the stomach and not staying back in the esophagus. That's integration of knowledge back in now. So the clinical anatomy should be translated to the healthcare setting and clinical medicine kicks in. But not to miss out, another key layer of theory would be a social theory. And this, I think, would be very customized for each one of our setting. For Malaysian setting is a different social theory, and maybe for the Indian setting or to an European setting would be another social theory. Now, what does it mean? It's not only important what students are learning and how are they integrating, it's also important how this learning is happening, in what context they're learning. And it's a whole big theory. If you go back to Biggs and Tanks, the 2011 paper of medical education, they talk about how the students learn in a different social context. For example, if any student is diabetic, for example, they're dealing a diabetic case, it's not dealt in the same fashion what they would be dealt in either India or in Malaysia or in Europe. Just for a simple example, in India, one of the good tips and advice you could do is to cut down on the rice intake. And if you talk that in Malaysia, people will raise their both eyebrows and they say, what? Because they don't understand anything else from rice. But if you go and talk about the same thing in Europe, maybe they would come back to tell you there's not much of rice there. So this advice may not be useful to them. So the social context becomes too important. Not to forget, we are not only training our student to be competent, we are training them to get their soft skills as well. And the social theory comes in that angle to hone their social skills and interactive skills as well. That would be a super important framework. Putting these three together will stitch back our interdisciplinary teaching learning activities. So if you're designing one, I think you should go into these theories in a much more detailed fashion so that you embed your interprofessional learning in a much higher fashion. What I would like to do is to a bit more go in detail of each of these theories. Sometimes when you look into a bit deeper insight, then you would get the tricks of actually pitching it back to the students in a better fashion. I had this privilege in my university to sit in curriculum reviews for at least 3 times. And every time when there is a curriculum review, we see that sometimes a major transformation happens and you see how the curriculum aligns itself with the outcome to be achieved, where the student learning experience is also escalated to the higher levels. Generally, in my observation, most of the medical schools around the globe operates in 2 modes. The first mode is more of a discipline-based or rather year-based. In this mode, it's all thought about the modules in a discipline fashion. For example, students will undergo anatomy training. They might also undergo physiology training, and later parts of the year, they'll undergo their clinical rotation training. And there's not much integration vertically, but sometimes there may be horizontal integration going on. But what has happened in the past few decades when contemporary medical education is coming on board, most of the medical schools have transformed themselves into mode 2. What is mode 2 is more applied and more integrated. There are a variety of these models which are available, which is applied and integrated mode. It's mostly the disciplines are broken down. They all come back in an integration fashion. Instead of sitting next to one another, they would actually support or eat into one another to say that how would they, a pathology, for example, will get into a diagnostic mode, and then that implies on a specific investigation that will call for a specific type of a management plan. So mostly we are heading into the mode 2. At my university, what we have done is we have gone a step beyond actual integration. So we have broken disciplines long, long ago, and we moved on to go on to become an integrated curriculum. From the integrated curriculum, we have moved on to become an outcome-based and also spiral case curriculum. And now we are trying to pose key challenges to the patients as opening learning platforms through which the integration has brought in a different angle. That means we are trying to be as close as possible for the real life experience for the patient so that they are really ready by the time they graduate to go for the clinical practice. So this is what we have done in the recent times. Just to elaborate on a bit of the cognitive theory, we will all agree with me that clinical reasoning is going to be the main pillar for medical education in a medicine program. Apologies, I must have chucked this in the audience. If you are from the non-medical background, it doesn't matter much. If you are going for a healthcare setting, the clinical reasoning would be applying for across all the professions again, because we are looking into patient safety and clinical reasoning. These are the two important pillars for medical education. Most of the times when clinicians undergo for the diagnostic mode, it's not a thought process which comes from single angle. It comes from the multiple angle. And the ill-script theory is the one which commonly talks about it, and dual process thinking, which takes into account the system 1 and system 2, where the integration happens right across all disciplines. And to be honest, it doesn't even just stop at the medicine. The clinical reasoning would take into account the ethics. It has to take into account the tech association. It has to take into account the local context and the same setup as well. Where I've been practicing, that should be respected as well. So all that comes together as a cognitive theory. Now that can come only when the students are trained in a similar fashion. Otherwise, when they move on to do the clinical practice, it's going to be an uphill task, and the new skills has to be taken up. Already we know how demanding it could be to scale up to a new environment. In my own experience, I ended up practicing in Malaysia as a seventh country. That means that I started somewhere in Northern America, then moving on to some countries in Middle East, and then I wanted to venture east, so I came back to Malaysia. And having passed through system to system, each system would pose a set of different demands to upscale yourself into being the clinical practice. And that's when this cognitive theory comes in. And how I wish in my medical education as an undergraduate, I had the training to see how best I can integrate everything together before I even make a dual process thinking. So that is what I'm posing today to you all. If that is something that we want to consider and then put up as a training part for our students as well, not just in the clinical practice, but right from the day one of medical education and training. Social theory, a big cheers for this because it's always the game changer. However competent we are, if we are not in an environment which is not supportive to you, then all your competency can go down. As a result, many things have surfaced out of social theory. Gotsky and team emphasized enough that if there is a learning in a particular social context, that will be a superior kind of a learning. How many of us will day to day talk about community-based practice? Long ago, we used to be more of a human-centric practice. Now we are more of humanity-centered practice. So we want to be in the society, part and parcel of the a regular population, and then take care of those health. So that is what social theory talks about. As a result, many of us will come together. We create our own COPs, which are communities of practices. We have common interests. For example, you could be looking into gynae group, you could be looking into ortho group, and etc. And we will share the best practices in those communities of practice. And a lot of learning sharing takes place in communities of practice. In my universities, we do have a good amount of communities of practice. Some people are more focused on research, some people are more focused on clinical practice, and they come back to discuss at their lifetimes to help each other. And team-based decision making is another key skill that a clinician should have at the end of the day. And then this interdisciplinary or cross-disciplinary teaching would be one of the best platforms to provide that. One of the key things that we do in my university is we provide students a chance to interact across professions. So a business student would actually be co-studying with the medical student, and then nursing, the biomedical students, they all come together to deliver a particular clinical case scenario dissection in a holistic fashion. So that provides the best platform for these students to keep looking at each other. What are their specific roles in management of healthcare setting? And then the decision making from each one of them actually increases instantly. So that would be the power of having a team-based decision making sessions with the students. Now, having learned a good amount of theoretical aspects, now I would propose to move on to see some of the practical experiences. And some of these are directly delivered in my university, and some actually I've learned it from the other experience from different countries as well. But before I move on to this, just a quick check if anyone has got any questions, or is there anything that you want to ask and elaborate. I'm more than happy to take that at this stage. And organizing team, if there's anything on the chat box, please also look through and then alert me if there's anything on the chat box that I need to address too. I'm still audible to everyone, right? Sorry, on online mode, I get sometimes scared that I'm only talking to my computer.
No, sir, you're audible and it's going well, sir. No problem.
All right, thank you so much. So if that is the case, if there are no questions, then I move on to my next part of the talk, which is sharing some of the practical experiences for this cross-disciplinary teaching. I think there are many models actually which can work well, but there are simple ones that I want to share with you, which has provided tremendous amount of success to our place and elsewhere, and probably everywhere. PBL is something which is very common, which stands for problem-based learning. Some places call that as a project-based learning as well. It depends on what program that you're dealing to. For medicine, just because we deal most of the times a clinical problem, so it will be a problem-based learning. No, problem-based learning is a concept. First and foremost, it gels with student-centric learning. Most of the times what we do, we actually design the curriculum, we deliver the curriculum, the expert goes in, and then we assess the curriculum and we say the student has either achieved or not achieved the objective. If you notice in that model, there's not much say for the students to say what would be important from their perspective. Maybe sometimes we invite them to meetings, or maybe sometimes we invite them to reviews, and that is the time they provide the opinion. But on a day-to-day job, on day-to-day basis, if you give a charge on their side, how would that change? And problem-based learning is one such interesting examples where student takes charge. You will notice that problem-based learning usually is a small group session, maybe 6 to 7 students, and there will be a facilitator. And I'm quite nice to use this word called facilitators. So they're not supposed to be teaching there, they will be facilitating it. That means their job is to make sure the discussions are in the right scientific manner. If they derail, they put them back onto the track. That's the job of a facilitator. It would typically start off with a clinical scenario. The students would be provided a clinical scenario. And in my place, we run problem-based learning as 2 sessions. So 2 sessions are 1 week apart. The first session will be 1.5 hours, and the student get a clinical scenario, and the students are encouraged to discuss and debate the clinical scenario. Ideally, what students do, the lower semester students would start on to identify if there were to be any tough, difficult terminologies. So they'll raise to one another, and they will check if any other students knows that, and then how did they explore it, what resources they explore, and they move on to pick up some of the highlights of the case of that particular problem. Then they move on to talk about the particular processes. If it is basic sciences, then they will try to go a bit more deeper into the processes. For example, I put an example there on the slide, chest pain case. So the moment there is a chest pain case, they would automatically don't think that's a myocardial infarction. What they want to focus is they want to focus on the pain per se. What actually is the pain? Where does it come from? What structures get involved? What receptors? What neurochemicals and things like that. Then they move on to talk about, if given the clinical data, what organ would be more important for this case? If there is an organ, then can I learn about anatomy of that particular organ? So let's say this turns out to be no myocardial infarction, they would talk about coronary circulation. Then they will talk about the perfusion around the heart. Then if it's atherosclerosis induced, then they go on, go so forth of this theoretical philosophies. So that's what happens during the session one, at the end of the session one, what they will do is they actually will identify their own learning outcomes. Let's say somebody is talking about atherosclerosis and most of them feel mum and they don't know much. That becomes their lesson outcome. They'll say, okay, now we, the group, should go back and identify this as one of the topics. So next time when they come back, we're going to discuss that in detail. So at the end of the day, they would have listed 6 to 7 lesson outcomes, and the facilitators make sure that that lesson outcome covers the key things what the intended session is supposed to do. Then the students are given a week off to go and prepare themselves. So after they meet second time, then they bring back all the details what they identified that they didn't know much in their first session. Now they translate that into a discussion. At the end of it, the problem-based learning can turn into a case-based learning, because now they're going to use all the information what they have and they translate that into a specific clinical diagnosis. They'll bring up even management plan and the discussion goes on. In my opinion, problem-based learning is quite a powerful tool. If you check on the traditional learning, we are the ones who design things and we are the ones who tell students what to learn. And students, yes, most of them are quite obedient. So they go back, they read it, they memorize it, and they go back to also be giving the assessments in the same fashion and everything runs smoothly. However, in problem-based learning, it flips it back and then it says, look, I'm not going to tell you what you need to do. This is student-centric learning, so you actually get the problem. So we just give you the clinical problems. And once it is assigned, now the students in a collaborative or team fashion, they're going to identify what actually they want to know about the case. I have facilitated so many problem-based learning sessions, both as a facilitator as well as trainer for problem-based learning. And I see that once it's effectively structured and delivered, it immediately elevates your student learning experience. Why? Because medical education is simply voluminous. You will agree with me, in total from 5 years to 6 year training program, the amount of data that the learner needs to carry is humongous. And no human brain like supercomputer can store that kind of a data, and you ask them and they narrate it back immediately to you. So in one side, accumulation of knowledge is important, but at the same time, retention of knowledge is super important. And these kind of learning techniques will help your students not just to acquire knowledge, but also to retain it for the longer times. The more you apply effectively in a real-time fashion, it makes an impact in human psychological theory that retention is for the longer time. And that's where I bet problem-based learning is in a much superior fashion in compared to our traditional learning approaches. The second easy example is the organ system model. I think most of you probably is familiar with this model because it's been there for decades already, organ system model. What does it mean is now the curriculum gets structured in such a fashion, the students learn the whole curriculum in an organ-based or system-based model. For example, student might start off in their semester one to do all generic things. For example, general anatomy, general pathology, general pharmacology, or things like that. And when they move on to do the second semester onwards, what they could probably do is to do module by modules or system by system. So at one point in my university, we had a system-based module where students started off with cardiovascular system, for example. They learn everything about cardiovascular methodology there. For example, it could be anatomy, physiology, pathology, which so integrates to one another, it feeds to one another nicely. So at the end of that particular module, student would be completely aware how a patient which gets involved into a cardiovascular disorder would probably present, and starting from anatomical details all the way up to the clinical medicals detail, they would be learning it in a holistic fashion. I've snapped an example from a timetable. This is not from a university, this is from a freelance of a Google timetable. Just because of a copyright issues, I don't put any specific timetables for particular university. This is fabricated one. And what you're seeing there is numerous disciplines are displayed across the same day or the same week. And that gels very well to one another because the student would have just started to learn about how are the muscles in the heart are shaping up. At the same time, they are also learning what kind of biochemical processes are happening. And slowly they're going to learn that if something goes wrong, what will translate into a pathology. And you will notice there's so many subgroups going on. There's so many small group sessions going on in the timetable. That's a classic organ system model that operates in the recent times. We moved on from this and we moved on more into an integrated fashion, and we now go to a KCP model, which is key clinical problems, and the student were given with the key clinical problem. For example, if student presents with chest pain now, and then they're going to learn from anywhere, cardiovascular system to respiratory system to musculoskeletal system to etc. So they cover the whole differential ranges for that, and they move on to the next key clinical problem, which could be probably palpitations, for example. And then they're going to learn even endocrine system like thyroid and etc., which could create palpitations in the patient. So that's another model where students would go on to the cross-disciplinary learning. The third bet is interprofessional education, and this needs to be by design. If you're going into implement interprofessional learning in your own setup, that needs to be in a particular fashion. Just to give you, sometimes the nomenclatures could be confusing. Interprofessional education could be different from multi-professional education. If you use a word uni-professional education, what it means is it means that the students are learning from same discipline or profession. For example, a traditional classic medical school would train students in a holistic healthcare fashion so that they become a competent doctor. But if they're not exposed much to how would a nurse work, how would a pharmacy student work, that means you're training them for a uni-professional fashion. Multi-profession is you get involved others into it, but not necessarily are going to collaborate. Interprofessional truly means that you need to have a variety of profession people come together as a team, and they interact to one another in an integrated fashion so that you co-develop the cognitive theories together. So that would be probably one. What we do in our universities, we provide ample amount of chance for the students to interact between the professions. So we design interprofessional forums, we design interprofessional days where these educations are explicitly visible for the students. And in a day-to-day fashion, also we provide opportunities for the different programs to mix together. For example, a Chinese medicine student is taught by a medical lecturer from the allopathic medicine and vice versa, so that it's learned how the other professions operates. And a common case is always attacked by multiple students from different programs to see how they all come together to aid in a scenario. So that's interprofessional education, and you need to get that as a design to come into your curriculum so that it enhances your cross-disciplinary education. I think, as I was saying in the early part of my session, we cannot escape technology, and simulation is such a been a bliss in the medical education. Just for example, if someone has to be getting trained as a pilot, so they need to have certain amount of simulation hours to be trained so that they're given a free hand to go and fly the aircraft. Exactly like that, I think medical education should also have a lot of simulations inside, because after all, you're dealing the most important creature on earth, which is humans. So before they touch the humans, they need to have a lot of simulation-based learning. But I don't see simulation-based learning just as an educational tool. What simulation-based learning can give you is it provides you that more close experience to a real-life experience. In my university, we have an immersion room. In the immersion room, what we do is we play different scenarios for the students they come in. For example, we create an emergency situation in an immersive room. It's a 3D approach. So the moment student enter in, if they're on the street or they're in some kind of a massive road traffic accident scenario where the people lying around, and they start to act immediately. So there's immediately this cycle, what I'm showing you as a simulation life cycle kicks in, and the student has to get on to an immediate action. Now you see that if the student comes in alone, they behave very differently. But if you put a group of students there, particularly from different professions, you automatically see that how they all come together to act on that particular case. We have a very interesting case scenario we always put for our students is a trauma case, which is a head injury case. And quickly, all students from different discipline comes together, including psychology students, and they have their own specific things to play. And that's why I put that last part as ethics and communications also, whether they're taking care of all those soft skills inside as well when they're taking care of such a scenarios in the patient. So simulation-based learning is another great platform where if you want to introduce cross-disciplinary teaching as well. And I take this opportunity for yet another level. It's not just enough that we introduce this cross-disciplinary between the departments, between the schools, or sometimes even between institutes. I think let's break the rule and go for the COIL approach. COIL stands for Collaborative Online International Learning. And I learned this from my own students, actually. My students actually participate in good number of networks. One, they have, for example, Southeast Asian Medical Students Network, or they have European Students Network, and we have a global student networks as well. Many of these networks, what they do, they freely interact with one another, and they share resources, and sometimes they actually share the teaching learning methodologies as well. And that's at the student level. But if we make a conscious effort, we can actually do it at the faculty level, where we actually design platforms for the students to learn from each other. In my university, we have a uniqueness in the program where half the program is done in Malaysia, and in half the program, they actually transfer over to the different parts of the world and they gain their final degree from there. It's a credit transfer articulation pathways that we do. So if that is the case, we are not only training students for my local context, we are also making students to learn for different setups. It could be spanning anywhere from North American territory to the Australasian territory. And that means we need to educate our students for different care models. So as I was giving some examples as before, for example, diabetes or a lifestyle example. So you need to give that in the local context and across context as well. So it's a great opportunity for students actually to do that. One of the shortcuts that we could do is to provide opportunities in the curriculum to let you students to go out and explore. Just for example, if you have electives or selective models in your curriculum, there could be a free weeks where students are let off from the curriculum and they could cover that curriculum elsewhere. Just for example, if you have a public health model and you want your students to get exposed to public health of different countries, so you give a chance for your students to go and do that in different parts of the world. They come back and they actually share the presentation with other students. Can you imagine 10 group of students going to 10 different countries and they come back and they share that experience back to you all? How powerful that learning could be when they learn from each other, and even for the faculty to hear from the different variety of diverse experience these students had. So that's the power of having a global multidisciplinary approach, which we often term as a COIL approach. So let me now decentralize everything. So after we learned some amount of the theoretical example, we learned a good amount of practical examples. Now the bottom line is all about clinical reasoning. Why we do this entire business of medical education is to get the clinical reasoning right. And perhaps what you're looking is critical thinking and you want application and synthesis of data. All of this need to be going on your students. That means what you want actually to do is to bring up the clinical reasoning in a methodical fashion. And that's exactly what integration does, which is the core pillar of the cross-disciplinary learning. Just for example, how do you learn any kind of a disorder in a clinical medicine? You start off with to learn with a definition. From the definition, you'll move on to talk about etiological causes. From etiological causes, you get on to do the pathophysiological process. From the pathophysiological process, you translate that into a clinical symptoms. Clinical symptoms would lead into complications. From then, you're looking into what are the gross and the microscopic changes of the tissue. Then you would pick particular investigations coming out of it. Then finally, you will develop some kind of a pharmacological plan for it. And if it is a bigger issue, you always try to bring a public health context as well. Just for example, non-communicable diseases. So if that is the case in the real world, what are we doing actually in the medical school when we're training our students? No different actually. We are doing exactly the same. So we start off to do anatomy, physiology, pathology all together, and then move on to do the clinical rotations, do it. But my bet now is once we are doing this, we need to be conscious to do the horizontal integration in a much nicer fashion. Also attempt to do the vertical integration as well. If we fail doing that, then probably this integration is not done in an optimal fashion. That would defeat your cross-disciplinary teaching purpose at all. So with that, I'm going into this advanced insights that all of us should carry when we're doing into your curriculum reviews. Integration is not just combination. So when you say anatomy and pathology are no longer distinctly taught, they're taught in a combined fashion. That's not so a good integration. So not just putting two things together. What is a good integration would be to get them to determine one another. For example, how does a pathology will determine into a pharmacological decision? Or when they learn anatomy, how does that clinically translate into something pathological and then that translate into pharmacological decisions? I'll give you one example. We do have in our medical curriculum something called as medical museum sessions. Medical museum sessions where the resources are, you have human models of anatomy. At the same time, they also have pathological models, which comes from the operative specimens. Then we have radiological specimens. Then we have some amount of clinical algorithms all lined up for the students. So let's say there is a case now of thyroid. So what students would do typically is to look at the thyroid model of anatomy. And while they're revising what are the key features of thyroid, then the faculty from a different discipline would pose them a problem saying that if there were to be a swelling in one part of the thyroid, what would that determine to? So there you translate already anatomy is feeding into a pathology. And if students determine that there was a tumor or something coming out of it, then they would go on to talk about what will be the choice of investigation. Then the radiology kicks in, and then you talk about what would be the determinant factor for a management plan. Then the pharmacology and other related discipline comes in as well. So we carefully design all this right from the year one of the medical curriculum, so that students get to train that these disciplines are not independent, but we conveniently do it such manner that the cognitive loads are chunked in a fashion so that when they learn from one discipline to other discipline, they're not too troubled. But they should be in a powerful position when they go to the higher years, that they should break all these silos. They should know that these disciplines were taught just for the simplification process, but at the end of the day, we are learning it in a much integrated and holistic fashion. With that, I move on to my next section, which will be the challenges for the cross-disciplinary teaching. I completely appreciate none of this is easy. What I was trying to say, that if each one of us, we have dealt into this medical education, would know that it takes sweat and blood to actually reach there. Number one, if the design is not careful, the students might actually get burnt out because of cognitive overload. Let me explain. Now, what used to be a simple anatomy or a simple pathology, now what we're giving to student is suddenly a complex version of the whole of the discipline intermixed given to them. That means your learning objective could be very diverse and could be lengthy as well for the students. So suddenly there's a good amount of information that students should synthesize, and after they synthesize, they need to analyze it. Once they analyze it, they need to apply it to a particular complex case scenario. So the load could be very high if the design is specifically gone wrong. And one of the greatest challenges that I always see in the medical education is just the superficial integration. Superficial integration is you stitch the content in such a fashion that it becomes more of a paperwork really than a translation into a clinical practice. So we have to consciously avoid a superficial integration, try and dig deeper as much as we can and take this integration into much deeper layers. Then the departmental silos, I'm referring to institutional frameworks sometimes. If you are designed to be working in a departmental fashion and silos, then that becomes a huge challenge. Just for example, how many times we have these chances to talk between departments and the faculty can freely exchange information, that this has been the info I shared in my teaching today and what did you share in your info today. That I suspect there could be less chances for that to happen, particularly when there is an institutional framework which operates around that model. So what is that I can offer for a solution to that is, number one, I think the key thing is to do is to scaffold the complexity. You first need to take into account what is the complexity of your framework. For example, in my framework, I have this curriculum broken down into certain parts that I need to scaffold. If you put that into a flat fashion right to your students, they should identify the milestones and they should identify what are the learning outcomes, and much importantly, the visibility of this combining and then integrating, translating into healthcare. If you made it visible straight to the students, their journey would be much, much easy and they embark on it nicely. My second bet is to keep your pillar on. That means your focus should be on the reasoning. The clinical reasoning takes the center place. And if you're bringing your cross-disciplinary teaching in a bridged fashion, you should know that this discipline should come together, but they should support one another in such a fashion that the clinical reasoning is upheld more than anything else. And my last bit today for you all is to just bring everything together now. Let's see what we got from the problem-based learning model. Problem-based learning model was talking about constructivism. The constructivism theory talks about the students develop the knowledge themselves. Actually, they grab information, they construct the whole thing together. That's good. Number two is, in the system-based curriculum, what we learn is we talk about holistic thinking. That means the student will be able to integrate anatomy right the way up to the clinical medicine. In interprofessional education learning, we are taking into account the team competency. That means how do they behave in a given social learning environment? And if you give them a simulation, actually you're trying to give them that kind of a real life close experience. So you're talking about experiential learning there. And in a coil fashion, which is at the global level, then you're talking about cultural competencies. So how to be sensitive, to be in different place, and how to take into account what are the things that you need to take care when you're practicing in a different part of the world. So that would be the holistic approach when you put in your framework for the curriculum review, and particularly looking forward for a cross-disciplinary learning. So colleagues, in my conclusion, what I want to say is the cross-disciplinary teaching in medicine is bridging the multiple academic fields. It's not going to be only clinical medicine. It could bring sciences along with humanities, which is a great deal at the present era. And technology is something inevitable. It always comes in, and a nice blend of social sciences too, to train well our all-round healthcare professionals, and what could be the core benefit of having this on board is you get a student or a learner who is more of an enhanced problem solver, and he can be a very good team worker, and a holistic patient care is taken care in a much richer fashion, and the guy is going to be a tech ready as well. So that's in summary, but I will leave you with some of the take home messages. First and foremost, we are not teaching subjects that I think we need to embed in our head. What we're doing is actually we are shaping how future doctor thinks, integrates, and acts in a complex human situations. So we are preparing doctors. We are not just preparing the subject experts. Number two is multidisciplinary learning is not just an innovation in medical education. It is the core essence of medical expertise. I think with that, I'm going to stop here. But if you have any questions, I'll be more than happy to take. I'll bring back this slide. Before that, I want to show you some of my students. These are my students. And then if you scan that QR, it will take you to my uni website. You can browse through all the programs that we offer. And Tarima Kashi is our local language, which is Malay language, and we mean thank you. I suspect the parts of the audience that I'm dealing today would be more of a Telugu. If that's the case, Dhanyavadalu. Thank you, everyone. And I bring back this slide. I just trying to open up this discussion. If you think this is useful to you, how do you do it in your place? How can you make it better to integrate knowledge in the formal student journey? And number two, much importantly, what I struggle is how do we specifically measure it? So let's say I've introduced this cross-disciplinary approach, but how do I measure the success of it? Because some people might talk about it's just a holistic learning, so I cannot break down the feedback now to whether the student's pathology was nicer or pharmacology was nicer, so I kind of struggle with that. So I open that for any discussions. Any questions or anything that you may want to answer on this areas of discussion, I'll be more than happy to do that.
Thank you so much, sir. That's an amazing and wonderful session had by you. I request anyone from the participant side who wish to interact with Dr. Purushottam sir, is welcome. Please interact and please ask any of your questions or doubts or something else. Please say a few words.
I'm very excited to learn from any one of you as well. How do you do it in your respective places? If I can.
Good evening, sir. I'm Dr. Deborah, Assistant Professor in Biochemistry, sir.
Hi,
Sir,
Deborah.
actually, we have UG courses as well as PG courses. In the UG courses, one major paper only, one or two major paper only we will be studying in the first year. And in the third year, we'll be studying 5 to 6 major papers, sir. But students in the first year, they were not fully known about the knowledge in the first year. Only in the third year only they came to know about some knowledge about the biochemistry. So in the third year only the students will be interactive. So in the first year they will not be interactive, only they will be observing. So in order to improve the students' competency, what we should do, sir?
That's a great question, madam. That's exactly what we also suffer in many parts of the world. I think when we mean by cross-disciplinary teaching, or even when you say that integrated learning, or even we want to bring in that higher cognitive learning for the students, we really need to be mindful that what milestone your students are in. It's acceptable that early year students not to have at a higher level of these things, but it's always a good idea to expose them. So I use this word called incremental exposure of higher cognitive learning. What you need to do is to, in the early semesters, give them the chance and observe how do they behave. Can I surprise you? We have this interesting activity called case-based learning. What is case-based learning is we give a case scenario for our students and we tell them, don't worry, whatever the year you are, whatever the semesters you are, I want you to behave like a junior student, junior doctors, and then come back to develop a management plan for this. Our early year students actually come back with a better management plan compared to the late year students because they're not biased. The late year students actually come back with a specific plan and they forget sometimes the other systems. Just for example, when someone comes with an abdominal pain, yeah, the late year students are so specific, they'll come back to say that's acute appendicitis, that's gallstones and things like that. The lower year students will actually go starting from the skin disorders, they can pick up musculoskeletal things like that, but their knowledge is so limited, they will not give you an extensive coverage. they'll say that this is what we found out. You have to give them ample amount of time. So in my short answer, getting them exposed is always a great deal right from the day one, but tell them explicitly what is the expectation. So you do not push them to a cognitive load. And same goes to incremental fashion. As they reach to the higher years, you need to explicitly say that this is your expectation from them. Is that helpful?
Yes, sir. Yes, sir. I understood, sir. Thank you, sir.
That's great. Thanks.
Thank you, Dr. Deborah ma'am. Anybody else who wish to interact with Dr. Purushottam sir, it is welcome.
Good evening, sir. This is Dr. Gayatri Indrakanti
Hi,
from
good evening.
Visakhapatnam. I belong to the Department of Mass Communication and Journalism. So that was a very elaborate, expansive, and highly motivating lecture, I can say, because so many things with regards to the teaching technique, to the strategies that you use in imparting knowledge to the college goers, or even otherwise also. It has been there are so many similarities, I can say, with regards to the teaching patterns, to the strategies that you have been implementing in the other side of the world in your universities. And while you mentioned the last one, I'll be focusing my work about this. While using this multidisciplinary, you said that case studies or kind of a case that we try to give, even in our educational system too, we are
Sure.
very much interested in using this case study methodology. And that happens at both UG as well as PG level, because that is something very interesting one that catches the attention of the students. Not only
Absolutely.
just that, it even makes them think by themselves.
Absolutely.
That's the beautiful part of the learning process itself. Because rather than just giving them something to take in, to absorb it into their minds, it's more about thinking what I need to do now for this kind of a situation. So that concept base is strongly sown in their minds, and so they come up with their own way. So since I belong to mass communication, I can say, so if I say this week's news, then they will pick up by themselves what kind of news do I gather for my presentation tomorrow. So should I gather some sports news, or some advertising news, or maybe something that is page 3, or what kind of news, or maybe some crime, some politics. So in general, so it's more of not only giving information but making them think by themselves. So that is, and if we are going to talk to students of management, or maybe someone who's from engineering background, then they will likewise do that kind of a little thought process they give to themselves. And case studies is a very interesting aspect as well. It really produces that kind of a good rapport, I can say, between even the teacher as well as the taught too, because even we get to know what is the not only the aptitude but even the intentions or the attitude of the student, not only as an individual but even as a team, because case studies and the kind of strategies that they follow is not just talking in terms of one person or one student, but they even have some group activity as well. They do things as teams, they function as teams, they collaborate as teams, and they even work in teams. So all these ideas what you were telling are very much in similarity with the things that are happening even in India. And that's something that has really brought in a lot of growth. And even teaching at higher level educational institutions has really has made a benchmark for themselves even in India too, because of all such kind of strategies that whether it is IIMs or IITs or even other colleges that are following in India as well. Thank you, sir.
Thank you so much, Dr. Gayatri. I can so much resonate to what you said is exactly the step-by-step that what I practice in my own practice as a teacher. And likewise, I participate in numerous conferences and other best practices platforms. It's exactly the same. I'm so glad that we all think alike, because we have this common responsibility to shape the next generation to be expertise, and not only experts, but they also do it in a much ethical and a structured fashion. And I'm glad to hear that this is the same best practices across the world as well. Thank you for reinforcing that message.
Thank you, sir.
Thank you, Dr. Gayatri ma'am. Thank you, Dr. Purushottam sir. Anybody
My
else wish to interact with sir?
Colleagues, it
Anybody
doesn't
from
have
the
to be only
participant side?
today. We are more than happy to collaborate with any one of you. All that you have to do is to just type my name and go over Google, and then you will definitely get my email ID. And I'm happy to collaborate with you all. It's so nice to be on a platforms where actually to get from a different backgrounds to different platforms, but we're on a common agenda that we train the next generation. And I take this opportunity to thank the organizing team to put me in such a privileged platform. I'm so happy and glad that I'm a part of this team. Thank you, everyone. Have a lovely evening. I'm almost hitting my dinner time, but I enjoyed spending my time with you guys this evening. Thanks,
Yes, sir.
everyone.
Thank you so much, sir. Thank you, sir. Thanks a lot, sir, for sparing your valuable time with us and for enlightening all with your auspicious speech. Thanks a lot, sir. Thank you.
I'm glad it was helpful. Thank you. Bye.
Thank you, ma'am. Thank you, sir. Thank you, one and all, for your patience listening. Without wasting much time, I would like to invite our next speaker. Our next distinguished speaker of today's day 15 of this 2-week international FDP program, Dr. Suresh, sir. I request Dr. Suresh, sir.
Yes, I can hear you. Yeah.
Yeah. Yes. Thank you so much, sir, for joining with us and sparing your valuable time to enlightening all of us. And thank you very much for accepting our proposal and invitation also to be as a resource person and distinguished speaker of this 15th day of our 2 weeks international FDP program, sir. Thank you so much, sir. Over to you, sir, for your speech. We are all eagerly waiting, sir.
Yes. Okay. So thank you for the introduction. And first of all, I would like to convey my good evening to the respected organizers, fellow faculty members, and dear participants. It's actually an honor to be here as a part of this faculty development program organized by Sidvi Foundation. Today, I'll be speaking on a topic that has a need of an hour. It's not like just relevant but transformative. Artificial intelligence in medical education and research. What are the present conditions? What are the future prospectus and current challenges that we are facing the use of AI in our day-to-day life? So far as being a medical teacher, I mean, like, we're all living in a time, the medicine that what we have learned so far is like driven by the textbooks and by the experience. But with the evolution of AI and its involvement, it's now the learning of medicine is mostly by data driven, algorithms driven, and intelligent system driven. So one simple question to all of the participants, that how many of you have already used AI tools like ChatGPT or Google Gemini, like Claude, any form? It's like in a research aspect also, is maybe in any one of the form for your education purpose or an academic activity purpose. I can assume that 100%. Being a teacher, researcher these days, no one without using all these tools, like, I don't think so. No one left with that. So now to coming to like the perception of artificial intelligence in medical education, it started in the way back like in 2021 after the post-COVID. Like once I was finishing the class and then I came back and then I was sitting in the department and then one of the student has come. So this is the topic which I didn't understand. I mean, like, it is too complex. Then I told her, okay, just go back. I explained her somehow, and then I made her to go back and read and come back again if she has any doubt further. Next day, she visited me and she said that, sir, I just used an AI tool to explain this difficult concept. And she said, like, sir, it is easy for me to understood and better than from a textbook. So then I realized, yes, we are no longer teaching the same world we were trained for. So with the technology, the impact that is carrying into the teaching as well as in the research is tremendous. So it's a time for us to move or to embrace this artificial intelligence to make it as part and parcel of our life. And today, then I'll be taking you all through regarding the artificial intelligence in medical education and research, that what is the condition of AI and its involvement. So where we are and what we are doing with AI, and what we are going to achieve with the involvement of AI in our day-to-day practices with respect to medical education and research, and what are the challenges that lies ahead of us. So to begin with, I'll share my slides. Just a minute. Yeah. Are the slides visible to everyone?
Yes, sir. Yes, sir.
Yeah.
These are visible, sir.
Thank you for the response. Yeah. So first of all, before diving into the topic, first of all, we should have an idea what is AI. Yes, everybody, as I said, everybody is having a basic idea about AI. Some are, some are very expertive by this time using of AI in education, especially in teaching activities and also research activities. First, but still, I'll be giving you a glimpse. So artificial intelligence is nothing but, in simple terms, which refers to the machines or systems that can perform tasks that normally require human intelligence. So this altogether includes learning from the data. It doesn't create anything new on its own. We should feed to the system the existing data, and also recognizing the patterns of the data, and also making decisions. Now, many people confuse AI with machine learning and deep learning, but all are together. They are not separate entity. If you compare this AI as an umbrella, okay, the strings which are attached to the umbrella, okay, the framework, they're all like machine learning as well as deep learning. So the daily day-to-day activities we are using, I mean, we are feeling that AI involvement. Example, what I can say, like when you're something typing over the Google, searching for something, so automatically Google will give you, and it will guess and it will give you the prompt or sentence before you. And also, when you are watching, if you are a movie lover watching Netflix, if you have loved particular genre of movie, it will recommend you automatically those particular genre of movies, right? And also, if you're coming to the medicine, so AI detects the cancer rather than an experienced doctor, because the data with efficiency, okay, with less time, with accurate specificity. So what I want to convey the message is that AI is not futuristic. It is already part of our daily life. So in this aspect, I'll be covering today's topic. So the objectives are like, what is the role of AI in education, AI in research? So what are the integrity challenges? So ethical concern related points, how to use. Are there any limitations of use of AI? So now to talk about role of AI in medicine. So AI in medicine didn't start yesterday. Okay. Initially, we had rule-based systems. Like if any something, I mean, like what to say, any new software or new pattern supposed to be implemented in the system, there are so many stringent rules. Same way it happened with the AI also. Now we are seeing tremendous acceptance of AI in almost all the fields. But initially, it has got its own hiccups. So first, before the AI, machine learn has come, okay, with improved data. After 2015, so deep learning revolutionized the healthcare sector, especially in the fields of radiology, pathology, and genomics. And the real booster for the tremendous development of AI, it is COVID era. COVID-19 taught us what is the importance of AI, because this COVID-19 accelerated the AI adaptation, because that time in that emergency condition, we were needed the rapid diagnosis and rapid data analysis and also predictive models for the treatment. So what we are seeing today about the AI growth is not all of a sudden thing. It's a result of decades of evolution. So now coming to the artificial intelligence in medical education, what are its current uses? So let's now move into like what to say, our core responsibility as a faculty to make better understanding of a particular topic of the student. So initially, nowadays, our teaching methods, traditionally how it was like teacher centered and one size for all. There is no customization. All 60 students will be there. There is no individual priority or customized teaching. It is one for all. One teacher will be teaching all the 60 students. It doesn't matter fast learners, slow learners, mid learners, it doesn't matter. But the involvement of AI in education sector, it has also completely changed. As I said, information is everywhere. With the use of AI, it's no need to be a teacher to provide the content to the student. He himself or she herself can get the information by using AI related to her content or topic. So now with the use of AI, we can personalize learning pathways to the students and also AI driving tutoring systems to the slow learners and also adaptive assessments. So if you ask AI regarding particular assessing the student, I mean like to develop or to create any assessment model, within minutes it can prepare and give you. So it gives the practice to the students so that for the better understanding of the concept and also preparing them for the better competition. So I can give like a student who is on weak on some topic. Okay. So with the help of the AI, they can receive targeted learning support instantly without any human touch or human association. And this is something like we could never achieve at scale manually. This is only possible by using AI. And next, so what are the benefits of AI involving in its thing in education? So like AI tools, like what suppose ChatGPT, everybody is using, right from the students to the researchers, scholars, everybody using ChatGPT. Okay. And also for the healthcare professionals, if you see, they're also using simulators, AI simulators for better enhancement and understanding of the clinical case scenarios and automated tools for writing and summarization. So as teachers, we must not resist this. We must guide them. Instead of asking why are students using AI, we can ask them how can we integrate AI effectively for the teaching and learning methodologies. So this way we have to MS or like what to say, embed the AI in our day-to-day teaching activities. So AI in research. So we already know the traditional way of research is if some researcher want to what to say, write a paper, first he has to sit, he has to go through hundreds of papers for to generate like what to say the existing literature, existing data, and also to generate hypothesis he has to think of a gap in the subject. So all these things are there which are time consuming, but the involvement of AI, what AI can do, we all already seen. So AI can analyze those 100 papers in minutes and it can summarize and provide you with the matter of interest, and also it can suggest you what are the loopholes or the gap in the particular research, and also it can assist you to develop or hypothesize a particular title towards the conduction of the research. So especially in bioinformatics, fields like bioinformatics, AI analyzes massive data sets, genomics, proteomics, and also metabolomics. So this is especially relevant to your domain or areas. That's what I said. There are no boundaries for the use of AI in respect to the research. So if you see the workflow, AI across the research, idea generation, literature search, data processing, writing and publication. So AI here, it completely offers you a meaningful assistance at every stage. But there is a limitation. So nowadays, almost all publishers, journals, they have all the AI tools again to catch this use of AI in your research making. So one should be cautious or careful while using AI, and also you have to mention what type of AI tools you have used to generate the idea and to conduct the research. So again, in clinical practices also, it's like as I mentioned earlier, so especially after 2015, like machine learning, especially in healthcare, especially in the subjects like radiology, and also to say pathology, genomics. Okay, especially in the field of radiology, AI has brought tremendous changes. So as the data you are feeding to the software, it will give you the specified, accurate results, okay, which give like the decision as like an experienced radiologist. Okay, maybe experienced radiologist may take time to come to your decision making, but whatever the data sets, information you have been feed it to the AI, it may give you 100% accuracy decision making. And AI not only in the aspect of radiology to give the decision making, but also to monitor the deteriorating condition of the patient which is lying in the ICU. And it is also helpful in cardiology also to identify the arrhythmias. But only one point here is AI cannot replace clinicians. They can assist the clinicians, but it cannot replace, because AI doesn't have empathy towards the patient. It cannot console the patient. And moreover, sometimes, because AI works based on the data that you are feeding to it, sometimes we don't know. The data may be biased. So as the data is biased, the outcome also may be biased. So what are all the research integrity concerns here regarding like publications also, like decision-making outputs also, clinical outcomes also, so plagiarism risks, so data privacy, all these things are there. So that means what? Fabrication. Yeah, by using AI, yes, anyone can fabricate anything and they can publish, but it's on their own risk. So as I mentioned, bias outputs. Yes, we don't know who is feeding the data to the AI, whether that feeding data is genuine or what to say, genuine or not, we also don't know. So one should have a integrity to check the outcome of the AI output. Okay, and also lack of transparency. So because whatever the data you are feeding to AI, it is exposed to everyone. So there is no what to say, privacy to the data that you are feeding to the AI. And plagiarism risk, yes, of course, you can, I mean, AI, it may not create new. Whatever there in the web or whatever there, the data that feed it to the software, that only it can replicate. So what happened, obviously, there will be a plagiarism checks. Of course, you might have faced the same. If you have published any paper by using AI, so if you go to Turnitin, if you place the content you generated through AI, it will definitely shows that it is a plagiarist. Just it is like you have copied from some website to here, right? So this way, use of AI also has its own research integrity concerns. And also to talk about um, precise medicine. So that's what, because before that, what happens, if I can give you an example, like what to say, diabetes, type 2 diabetes, person who is having two diabetic people are there, they went to the physician, so he has suggested metformin to both the patients. But how it is possible, like with the involvement of AI, it is possible to provide precise medicine to each patient. Yes, they are suffering with same disease, type 2 diabetes, but the choice of drug or the dose may vary, because same disease, two patients, they respond differently. That's where the role of AI comes for precise medicine. So it is also again tailor-made. by involving AI in precision medicine, it is a tailor-made treatment to each and individual patient. So now coming to the laboratory medicine. So by using AI, we can explore or also identify the things which we cannot see through our eyes, like the metabolic changes that are happening inside the cells, abnormal protein patterns in the serum, the circulation, and also the abnormal production of metabolites. All these things can be evaluated by using AI, especially in the biochemistry and laboratory medicine. So that's why biochemistry and other laboratory medicine things are no more diagnostic. They are more of like predictive. They are not no longer the diagnostic way. They are going to be a predictive. So authorship and accountability. So who has to take the accountability? Here is my question to the audience. Yeah, who has to take the accountability? Either the software is supposed to take the accountability or the user has to take the accountability. Anyone? Yes, according to you, the software has supposed to take the accountability of whatever the outputs of AI, or the person who is using the AI, who is going to be accountable?
The person who is using the AI.
So that's where, see, it is a software. That's what I told you. The whatever the data you are feeding to it, it will give you the same output. So here, because software doesn't have any life, and software doesn't it doesn't concern about any ethical integrity or something. So at the end, it is on us humans. So finally, the accountability is all coming to our human heads only. The person, the author who is using the type of AI, he is going to be responsible. That's the reason we have ethical integrity while you are using AI. So AI cannot be an author. So that's what I said. Like, so ethical responsibility solely by the human, and the involvement of humans for the accountability is mandatory for whatever the software with the involvement of AI involved. So there also lot of public journals, publishing houses, before accepting the paper, they'll ask you to give the disclosure. What are the AI tools you have used to generate the literature, also any graphical abstract or any images that you have generated by using AI, to avoid all these conflicts. So what are the ethical issues, especially in medical research, by using AI? Because as I mentioned, as you start feeding medical data to the AI, it's no more privated information. It is all over the web. So anyone can access it. So there chance of misusing the what to say, privacy breach with the patient data. And also bias. So suppose if 100 data sets of clinical case scenarios of some XYZ disease you have been fed to AI, sometimes what happen, the people who are with their wrong outputs, they are fed it to the system. So finally, when you are using those outputs, your output is also going to be the same way. So here the output is also biased. And reproducibility. So AI generated findings are often difficult to replicate and threatening the foundational principle for scientific rigor. So, and also over reliance on AI is also not acceptable. So challenges. Recently, yesterday only, I just come across one paper published in the Nature. So too much, especially in healthcare learners, especially medical students, too much dependence of AI will stop or deroute their cognitive thinking. So decision making also they cannot take. Simple, if I given some assignment without any reasoning question, so without thought process, they use the AI tool or chat GPT for the explanation, and they will submit it. But the thing is, that's it done. Then they have not thought of what is the reason behind that clinical case scenario. Okay, then how they are going to be a better doctors with the better basic knowledge, with the better reasoning out of the clinical case or clinical based learning. So this way, they are not encouraging too much dependency of AI, especially in medical education. Yes, it will assist you. And why? Because what happened? There is a accessibility. Because as I mentioned in the beginning, we are so far like what to say, we have gained our knowledge, learning skills through the textbooks or from the experienced teachers. But with the evolution of AI, it is no more standard of teaching like that. So there are AI tools are available across the globe, and they are using like anything for their betterment. But in this process, yes, they are getting exposure to the millions of the data sets or the patient outcomes, clinical case scenario outcomes they are exposing. But the thing is, they are deteriorating their own cognitive thinking. So this type of mentality may not useful or handy in near future in emergency conditions to when it time for the decision making. So institutional challenges, yes, in India we do also have like what to say, gap. Still our institutions are not ready to embrace or what to say, to involve the AI in the curriculum development also, or like teaching learning methodologies also. Still they are like what to say, they are in the pedagogical method only, not in the use of like technology. So what is the main thing is there is no clear cut guidelines for the involvement of AI. And also faculty training gaps. Many educators lack the technical literacy and pedagogical frameworks needed to guide students on responsible AI use. And detection difficulties like current tools for identifying AI-generated academic work remain unreliable, making enforcement inconsistent and contested. And to talk about the future of AI, yes, in near future, all the hospitals will be AI driven. Because as I mentioned, 100% accuracy and also the precision of AI and its role in diagnosis, not only diagnosis, monitoring the patients also. That's what I said. In near future, we can see automated hospitals. You can see AI driven hospitals, right from the ICU to laboratory medicine. And precision medicine, just now I said, because every human will behave or respond different type of medicines, though they are having same disease. So yes, two patients having the same disease, but they respond to the differently, and their response will be way different for the same medicine. So there is a customization or tailor-made dose or medicine for the particular person. It is possible because of the AI. And automated research pipelines like end-to-end AI systems capable of hypothesis generation, data analysis, and manuscript drafting. And digital twin patients like simulators, so I can say real-time experience by using AI. So virtual patient models, so that stimulate physiological responses, enabling safer drug trials and personalized care planning. So the future, as I mentioned, like simulation, AI in simulation is already almost all the medical colleges across the globe they are using this simulation with the help of AI. And competency-based AI evolution is like continuous objective assessment of clinical skills and knowledge mastery, moving beyond traditional examinations. So what are all the opportunities that AI brings to medicine? Is like faster research, yes, time, whatever the time consumption, we can reduce it. At the same time, improving diagnostics. So because of feeding of millions of data, it can easily, and with a lot of, I mean like 100% of accuracy and speed, it can give you the results. And with the use of AI now, so before COVID, I can say this is also the best example I can put over here. Before COVID, it's like engineering is separate entity, biological science is a separate entity and medical sciences are a separate entity. But thanks to COVID, after the COVID, we come across there is a need of collaboration or interdisciplinary research. So that engineers came up with this machine learning and neural networks to implement in medical sciences, so that we have got this beautiful AI tools, so that which are handy in case of rapid diagnosis and pattern analysis, and also for the proper treatment planning. And to talk about lastly the risks when AI is misused. So the same capabilities that make AI powerful also make its misuse consequential. The risks are not hypothetical, they are already emerging. So scientific misconduct that we are facing. So because we have seen the race that all our universities in India are running for the paper publications, for the NRF rankings or the NAC criteria. So they're pressurizing the faculties. Obviously, faculties, where they go, they'll be using the AI for the generation of the papers. Now they're all like, what? There is another AI tool which is catching all those AI generated papers and they are getting retracted. So this all comes under scientific misconduct. And also AI generated fabrications, and though there are no references, by using AI, they are creating those references for the citation purposes. So which is again a scientific misconduct. This is increasing day by day. Especially this pattern has been observed in Chinese researchers. Now it has been slowly embedded in our Indian research systems also. And loss of originality, over dependence of AI on writing and ideation risks, homogenizing research output and suppressing genuine innovation. Ethical violations also there, the patient data misuse, unconsented AI modeling, and opaque algorithm decisions, which foundational medical ethics also be violated. And there is a less human expertise, like routine delegation to AI erodes the clinical and analytical skills that define a competent and accountable physician researcher. So to be safely to use the AI under the guidelines of the ethical usage. So only the thing is, use AI as an assistant, not a replacement, and always verify AI output, because software doesn't have any emotions or any reliable thinking. Only humans we do. So always cross check, double verify whenever you are using any AI generated output. So maintain full transparency. That means legality. Wherever you are using AI, disclose it. What type of AI tool you have been used. There is no harm. No one is saying that not to use the AI. But how you are handling and how you are using AI, they want you to disclose. And what purpose you have used. Because now the journals also, when you disclose the use of render for the image generation, for graphical abstract preparation, and also like cloud or deep search, if you for the sum of the literature generation, it is okay, they're allowed, but not extensively like 100%. So, and also follow the journals and institutional guidelines while using those AI tools, and also train the students. Yes, don't resist them, allow them freely, but and also teach them the limitations of use of AI, and what are the risk factors that involved freely and over dependence of AI in their assessments are like learning methodologies. So here is my last slide. So key take home messages like AI is, yes, of course, AI is powerful, but it is a double-edged. As there are pros, there are also cons also there. So one should aware of both the things while using this AI tool. So research integrity is central challenge, and ethical use is not optional, it is mandatory thing. And human oversight is irreplaceable. Whatever the AI tool comes, it may not replace the humans. At the end, the outcome supposed to be watched by the human object only. So the integrity of medical science depends on the choices we make about AI today. Oversight, transparency, and ethical commitment are not constraints. They are our greatest assets. So with this, I will end my topic. Thank you.
Thank you so much, Dr. Suresh sir, for your amazing and need of the hour presentation. Because one should learn all these things being an academicians and researchers. Thanks a lot. Anybody
Yes,
from the
house is
participants?
open for question and answer session. Yes.
Yes, sir. Yes, sir. Yes, sir. Yes, sir. Anybody wish to interact with Dr. Suresh sir is welcome. Anybody from the participant side, please.
Yeah, that was really a very nice, interesting, sir. Something that we are working on, but didn't realize how much of a role it has in our lives. Not only for us as faculty members, but even how students respond to the work that we give. Yeah, because we are living in such an age where they have a better edge. I should say from my personal this thing only. Others can have much a better knowledge than me, but I can say that sometimes students know how to get the answers what the faculty is expecting in a much easier and a smarter way, and there's no harm in that, because today we have come to such a level that not only knowing the answer but how to derive the answer, that is also very very important. It's like you need this kind of an answer, I have a better way of presenting that. That's how students have really become, thanks to AI, thanks to all the kind of machine learning that is happening. The way the algorithm works for them is at their fingertips, and that's how the race is going on. And we can't keep saying or complaining about how people are becoming much more digital, technologically depending, or all these words. That is just only someone who wants to blame or who wants to complain and doesn't want to grow, I feel. If we are lagging behind in such areas, then we'll be left behind. That's the only thing. But if we want to be in the show, if we want to be visible, if we want to make a mark of our own, then we just have to go blend with everybody. The generation that we are talking to, the generation that we want to see in our future, and the generation that we are from. So all these three cohorts are supposed to be in sync with each other in their minds, in their intellectual capacity, and in much more vision that they all three need a good collaboration. That's how I feel in today's times. That's how knowledge can really become reachable for all of us. Otherwise, knowledge can't be kept in silos, first thing, or even in some kind of boxes where, okay, you don't belong to this generation, so this knowledge is not meant for you. So nobody can ever say like that. If we all think about, basically knowledge is something that we have to share, and basically this is what is needed. So as you started with your topic, the first, when you spoke to us, it's you said that everything has to be shared, everything has to be kept ready for all of us. That's
Yes.
where the point comes in. So it's not about keeping that knowledge with us, or doing it only from one perspective. That's really something that has amazed me from your presentation. I learned a lot from the way you have presented, and I really appreciate you.
True, that's what being a teachers, it's always like what to say, it's a responsibility for us, like shaping the future minds. At the same time, we have to be one step ahead beyond the students.
Yes, sir. True.
Yeah, why? Because students are smarter, this generation is smarter than us, and we have to accept that. At the
Mm.
same time, we also supposed to be smarter, and we should find a way to be one step ahead of them. Because what happened if I want to give one assignment to them? Yes, simply what they do, they'll just go and they'll ask ChatGPT, finish the assignment, they will come back and submit. But my real worry is, yes, I'm very much happy that they are using the AI tool for the submission of the assignment. But my real worry is whether they actually got the assignment with the reasoning, especially in the fields like medicine, medical education, especially because they're going to be doctors, and they should be learning their cognitive skills to embed the reasoning. Without that, there is no point. So that way, I have to use ChatGPT or any other AI tool, like what to say, though they ask help of AI tool for whatever the assignment I'm developing or like framing, it should process or pushing them towards that understanding of that reasoning.
Yeah,
That way I have to
exactly.
create. Yeah.
Yeah, I think you just have to mention. I mean, what I understood from what you are telling and what I was also feeling in the same way is that knowing what to ask and how to ask, so that that reasoning, basically, you said that word reason, then I would say in English, when we studied in our school grammar, we had this point called question tag, asking a
Yes.
question. So it's a question tag is not at all asking like a question. So
No,
is
nowadays
asking a
students,
question.
students stopped
Yeah.
questioning us. Students
Yeah,
stopped
so
questioning.
it's not questioning. It is asking a question tag, which always means that what kind of an answer are you expecting? So you are asking will be in that way. So it is more of prompting. The way I prompt, the way I get the answer. So I get answers. I get more number of answers. So the better I prompt, I give my prompt, the better I get an
I
answer
can
for that.
design or develop the assignment. Yes.
Yes, yes. So that it's not just one way or one sided. It's much more a holistic way, and that's the beauty when if we try to use AI in a right way, like
Ex-
using it as a complementary, not like depending on it. That's how I feel. So,
Yes. Thank you, Dr. Gayatri, for your inputs.
yeah, thank you, sir.
Thank you, Dr. Gayatri ma'am. Anybody else wish to interact with Dr. Suresh sir? It is welcome.
Good evening, sir.
Good evening.
Good evening, sir. I am Dr. Hamida Khatun, Assistant Professor, Department of Mathematics, South Chalmara College of Assam.
Okay.
Sir, you have given a very important and informative presentation. So thank you so much, sir. Sir, is there any, I think there are some established standardized methodologies to validate AI derived research findings before they reach clinical application, isn't it, sir?
Yes.
Yes. So, how do the medical institutions establish standardized methodologies to validate those AI derived research findings?
Research find, see, AI can give you the ideas. At the end, you are the one who is going to implement. So
Yes,
the
sir.
AI generated ideas, yes, it may be vague. That's what I'm telling you, right? So it can analyze from the existing literature and it can generate a hypothesis. From that, how you are developing the idea, that is important. You cannot blindly,
Yes, sir.
it can give you some vague hypothetic ideas also. But at the end, it's you who have
Yes,
to
sir.
take the call.
Yes, sir.
Yeah.
Yes, sir. Thank you, sir. Thank you. Thank you.
Yes.
Thank you, Dr. Hamida ma'am. Anybody else? Anybody from the participant side wish to interact with Dr. Suresh sir? Thank you, Dr. Suresh sir, for your wonderful and amazing distinguished speech on this juncture of 15th day of our 2-week international FDP. And thanks a lot for accepting our proposal and sparing your valuable time with us, sir. Thanks a lot, sir. Thank you so much.
Thank you. Thank you once again to the organizers. And I want to convey my special thanks to Dr. Vamsidhar Annam for providing me with such a beautiful opportunity at this international platform to share my thoughts with all the beautiful dear participants. Thank you.
Thank you so much, sir. Thank you.
Thank you. Thank you.
Thank you all the participants for patience listening, and almost we came to the end of this 15-day international FDP, and we came to the last distinguished speech by Ms. Mahalakshmi from Tamil Nadu. Ma'am, are you there, ma'am?
Yes, ma'am, I'm there. Good evening.
Good evening, ma'am. Good evening, and
My
without
voice
wasting
is audible. Sorry.
Yes, ma'am.
yes, ma'am. Your voice is audible.
Thank you so much.
Without wasting much time, over to you, ma'am. Please start your presentation, ma'am.
Yeah, thank you so much and good evening to one and all present here in this FDP. Let me introduce myself. I'm Ms. Mahalakshmi. assistant professor from the Department of Corporate Secretaryship, Etraj College for Women. So, moving on to the FDP topic, I don't want to waste much of time of yours. So, let me begin with a simple question of this FDP. Okay, this is regarding to AI and whatever it is. Okay, so if AI can generate answers in seconds, what remains the responsibility of a teacher and the researcher? Can anyone from the faculties or the audience can tell me? If AI generates answers in seconds, what remains the responsibility of the teacher and the researcher? Isn't a futuristic question or which has been currently prevailing as of now? Anyone? Yes?
Ma'am, can you please repeat the question once again?
Okay. We are just posting the questions in AI, whatever tools it might be. If AI can generate answers in seconds, as we see, what is the role of researcher or teacher or the students? If AI can give everything, what is the role of the researcher or students? What innovative they can give? Is it a futuristic question or it has been prevailing as of now?
The use of
Yes.
AI is prevailing, but the question is, how do we take it forward, or how do I visualize this in the coming future? That can be an
Yes.
alarming one. That should be a concern for both teachers as well as students, because they are the ones who will be using. So how much do I depend on AI, leaving away than how I can create it by myself? Because everyone starts depending on AI. Not in the right way or wrong way. We are not talking about right or wrong here. But how much do I depend on it than depending on self? So how much do I know much more better than someone can be another alarming concern for the future generations in the future. This is what I feel.
Yes. Thank you, Dr. Gayatri. Mainly, this topic is based on ethics, trust, fairness, and the academic integrity in higher education and in the research. Okay. So let me share my screen. Please do tell me if it is visible to everyone. Is it? Is my screen visible?
Yes, ma'am.
Yes, ma'am.
Thank you so much. Before moving to the topic, you are going to decode what is my FDP topic is. Okay. Two examples I'll just show you. The first one is being shown in the screen. So can anyone decode what is it? What has been shown in the screen actually? Something is being marked in that red color. An article has been given in the newspaper. But what is that something marked in that red color? Anyone?
It is a conversation between AI and person.
Actually, what is being shown in this article? It is from a popular newspaper, but I don't decode the name of the newspaper or what is the publication or anything. Something it has been shown auto sales revered up in October or whatever it is. But what that last line showed now? What did the last line actually say, which has been marked in,
It is a
highlighted in?
conversation between AI tool and a person, I think.
The article is actually been copied from ChatGPT or Perplexity or any other article and it is been placed. Is it?
Yes, ma'am. Yes, yes.
As of now, in research, it has been creating an alarming issue. Retraction of articles and copying and pasting from ChatGPT and Perplexity. So my FDP topic is on ethical issues of AI in research and higher education. And next thing, I'll be showing you some statistical things. Can you just see this? Countries with higher retraction rates and anything? Yes. So what is this statistical figure shows now? Anyone? What is actually being showed here? Am I audible?
Yes, ma'am.
Okay. What is the statistical figures being showed here? Actually, countries with higher retraction rates. First stands the Saudi Arabia, last stands India. That too 15% India shows. Why should India be in that list? Anyone? Why should India be in the highest retraction rate list? Any reason? What could be the reason actually? Anyone who likes to answer?
Plagiarism can be one reason, or maybe AI generative, using AI generative tools may more.
What could be the reason for higher plagiarism? Anything? We are very much innovative. We are very much innovative in providing research papers or anything or whatever it is. But why India has to come in that 15% rate? What could be the reason? Because faculties, institution, it is a bitter truth. We have been compromising quantity over quality over publications. We want more number of publication over quality of the publication. So for that reasons, as of 2026 rates, India stands as 15%. It is not that we should not be using AI for research or AI for higher education or whatever it is, but we should see under what limit AI can be used accordingly without coming into this list. Okay. So ethical use of research, AI in research and higher education. So moving on with the introduction, we are here to discuss artificial intelligence in higher education and in the research. So what do you mean by this AI? I'm not going to the old tale of meaning of AI. It is just an intern that came and immediately took over everything. It started writing emails, it started writing research paper, it started drafting letters. What have not AI has been into that? Even in finance, AI came, like blockchain, cryptocurrency, everything and everywhere AI sector is being taking over. And to summarize articles or to revert fact with greater facts and anything. So this is practically why ethics matter. And AI can be useful, but usefulness without responsibility is simply effectively traveling in the wrong direction. But even say in higher education, we cannot ask only, can AI do that? But we must also add, should AI do this correctly, or should AI do this with complimency or whatever it is? Okay. And why this is a concern? Anyone can say why this thing is being a concern as of now? Anyone? Ethical use of AI in research and higher education. Why this has been an alarming issue as of now? Anyone from the audience?
Yeah, one can be that since it's a very, I can say it's not there in history or maybe in the past, even
Okay.
not even in the near past, that
Yes.
we could have had some rules and terms and conditions and something that you should not violate, or what would happen, what kind of a legality will be imposed on us if we get into such kind of an unethical practice or anything. So since these rules and regulations, terms and conditions are already not laid, yeah,
Yes.
someone who might have gotten into this wouldn't have even known what would happen if what he's doing. So the new policies should be made, and that should be visible to everybody. People should know that. So since it's a new thing, a concept which has gotten up recently, things should be much more clear for people in their minds, so that they don't get into something what they have unknowingly or in an innocent way, unless and until someone is doing it in purpose, has gotten into this kind of a nudge without their intentions, with positive intentions, maybe, should we say so? Or maybe, as we said, to catch up with the competitive world, compromising, or at the cost of their quality, they might be doing because they want to count on numbers. And that too, ma'am, I feel, since India is a largely populated country, yeah, there
Exactly.
is so much of human resources. The best thing that India can have right now is human resources. So how
Yes.
best should we use to compete in this race? Yeah. So because I turn around, my two eyes will look into so many pairs of eyes and so many pairs of ears, which are already competing with me even without my notice. So in such kind of an era, what can we do other than doing something out of our own wish and will? Maybe that somewhere people might have gotten into this. So without their notice, someone might have gotten, or without knowing it, they might have gotten into it because rules are not already framed. So it's
Yes.
these days that people should have started realizing the not only the pros of having AI, but the cons also. So they might have started framing some kind of policy. So policy decision makers might have actually started gearing up and then coming up with the policies. This is what I feel. I might be wrong also.
No, 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 not exactly. And even in higher education, if you see, faculty life is been very much changing, because before and all, we used to be concerned about students should not copy from one student or another. Even assignment should be creative or whatever it is. But in today concept, if you see, they should not copy any from the chat GPT or whatever it is. Somewhat, even if it is simple, also please do give your creative content. We used to be telling them. But even though students have been using chat gpts and anything, but the ethical concern has been main thing a lot. And one more thing, AI has entered academia very much fast than any other thing. All the spheres in academia is been using AI for plagiarism check, for content creation, or for idea creation, for title, and for everything what not. Yes. And UNESCO has been reported some institutions has already been given the formal AI policies, and many institutions have been and still developing guidelines, which shows both the urgency and uncertainty of use of AI in research and higher education. So with this FDP, if you see, it is not about panic, like we should not be using AI or whatever it is. How clearly, how ethically, how formally, like for what reasons AI can be used. So for that itself, this is a concern. Okay. So as everybody knows, these are the commonly used AI tools and resources like ChatGPT, Perplexity, and Perplexity is being commonly used for many researchers and editing. Assistants can be given like Lit Maps, Google Search, like Research Rabbit for literature reviews and for literature resources. AI has done all the works, which has been very much feasible and everything. Okay. So moving on, what is meant by this ethical AI? So it is not that AI use polite languages to give some contents or whatever it is. That means system and practices that respects right, fairness, transparency, and the accountability in whatever content creation or whatever which is being given. As coming back to the UNESCO ethics and guidelines towards the research, AI use in exactly in these principles. Like in practical academic terms, it means machine may assist the work, but human still owns the judgment. We give the prompt, AI gives the content. So we should be accountable for the prompt which has been given, and we are accountable for whatever results it has been given. So if something goes wrong, we cannot blame the algorithm, but the way students blame the Wi-Fi during the submission event. That's a satirical example I can give, as well as meant by ethical AI or whatever it is. So AI in teaching and opportunity. Let's be fair to the technology. We cannot blame technology in all the way. It can help faculty with lesson planning, content creations, assignments, quizzes, example, and everything. Used well, ethically, it can reduce repetitive tracks, and teachers can spend more time in any other works. But in research also, if you see, it can help scan the literature, it can cluster themes, can organize notes, it can support coding and assist in the earlier drafting. It can shows you some draft of how this research can be given, what and all can be included, everything it gives, but the content has to be given in an ethical format or whatever it is. It saves time, especially when it is very much the information is very heavy or more of the literature review or whatever it is. But speed is not as same. It can help move faster through the information, but it cannot replace disciplinary in research or whatever it is. The methodological rigor or the intellectual responsibility, AI tool that summarizes 200 papers in 20 seconds is impressive. Yes, it can summarizes 500 papers in 10 minutes or whatever it is. All the summaries will be given in each and everything. But the human should check whether the integrity, accountability, and everything, whether it is correctiveness and everything. Okay. The ethical risk. This is where the review begins. It can produce convincing, but also at the same time, the false information. It reproduces bias and encourages over dependence. But where does the creativity goes in higher education and in the research? The danger is not just AI get things wrong. The danger is it get them wrong in the English and the language in which it has been used. And academia has always been vulnerable to the conference dressed in the competence. So, as the faculties and the researcher must treat AI output, the draft materials to be integrated and not the truth to be admired. Not the truth to be admired, it's blindly copying the content and just providing that anything. Okay. So, academic integrity has entered a fascinating new phase. Like assistance is not authorship, and the disclosure of the AI tools is matter and anything. And we are no longer asking only did the student copy from the another student who exactly wrote this paragraph or anything, where this actually been copied or where this actually been provided and anything. So AI generated work raises serious integrity concern. So where does the creativity goes, whether it is a true information or the false information or an outdated information or whatever it is regarding the policies or anything. It's not a paranoia. The answer is a clear policy, the transparent expectation and assessment design, which values the thinking process and reflection over every integrated output. And regarding the transparency and disclosure. So, what do you mean by this transparency and the disclosure? How in AI we can be transparent and we can disclose the facts? Anyone? So, what does this transparency means? Declaration when AI is being used. So, what is the declaration actually? Anyone?
Not much of an idea, ma'am.
Sorry?
I'm saying I don't have
Mahalakshmi,
much of an idea.
Mahalakshmi ma'am, you please continue with your presentation rather than asking questions, please.
Yeah, thank you. Yeah. If AI is used to draft, edit, code, summarize, or brainstorm, the role should be disclosed wherever relevant. Like students should be asked where the AI is being used, that the AI is being used for brainstorming or the AI is being used for the content creation or whatever it is. So that is meant by transparency and disclosure. So their knowledge is also be included and the AI knowledge is also be included, that they are not being more dependent on AI alone for everything. Their knowledge is also be given and not decorative values is being given actually. Okay. So human oversights. So people do not panic because there is a AI oversights has been given, but it does not decides. AI supports but does not decides. AI supports is whatever content in which we are being given. It just gives the additional thing or whatever it is, but it does not decide that you should do this content or you should do this thing or whatever it is. It's just a supportive mechanism rather than the deciding mechanism or whatever it is. Okay. So AI is not neutral simply because it is being digital. When it comes to education, it matters deeply because bias system can affect feedback opportunities, or representation in both education and in the research. If a tool consistently understands only one kind of learner or one variety of knowledge or one worldwide, then it is not innovative. It is called as exclusion in the machine speed. Inclusion and equity are not decorative values, and UNESCO guidelines come through this. But most important topic is the privacy in which AI plays. Every other prompt, every other information which you gives, everything is stored in the back records, and everything the AI saves. And one more thing, many AI tools process prompts, uploads, and interaction data, which means confidential students' information, unpublished research, or sensitive materials should not be uploaded casually. Everything has to be scrutinized confidentially and it should be uploaded. And one more thing, faculties, researchers, and those who use AI must remind ourselves that convenience is not the same as the consent. But because a box says paste text here doesn't mean your ethics committee has approved to those your ethics and anything. But before going on to the content, we should see that everything is not being disclosed, artificial and factual. So what are the good practices for the responsible AI? Only few practical rules. Remember, verifying the contents, disclosing, protecting, and thinking. I'll repeat, verifying, disclosing, protecting, and thinking. That is nothing but verifying the facts, references, main thing, the citations, analysis, and the interpretations. These 5 things in where retraction of articles mainly thing happen. Citations, the author will not be existing at all, but ChatGPT gives the prompt. Where does the ethical concern goes then? So disclosefully meaningful, that is meant by where did I use this AI, for what reason I use this AI, for what brainstorming I use this AI, that should be given. Protecting sensitive data, and institutions, all the institutions should pay attention to equitable access. That is, institutions must frame the guidelines how AI can be used and how it has to be given. If more AI is being used, what could be the retraction rates can be given. Everything institution also must frame the policies and anything. If AI advantage becomes available only to those most resourceful learner, then innovation quietly becomes inequality in a blazer. That is, only the resourceful person will get all the benefits of AI, others won't get. It should not be happening. So if you remember only these practicals use, remember these: verifying, disclosing, protecting, and thinking. So moving on to the last slide, AI may be becoming a very capable assistant. By higher education and research is not merely a factory of the outputs or whatever it is. It is a space for the integrity, inquiry, and intellectual formation. So the goal is, our goal is not to defeat AI or not to fully adapt to it. The goal is to use it wisely, critically, and ethically without becoming the sort of professional being dependent to it. So, by this, I'm just concluding my FDP. Thank you so much.
Thank you, Mahalakshmi ma'am, for your wonderful, distinguished speech on this juncture on the last day of our 15-day international FDP. Anyone wish to interact with Mahalakshmi ma'am, it is welcome. Anyone from the participant side? Anyone would like to speak a few words about as your feedback or about this FDP over these days, because all of you are very actively participated and we are all got enlightened with all the distinguished speech over all these days. I wish to hear from any one of you a few words about our event.
Good evening, ma'am. I'm Deborah. It's very informative and very admirable one, ma'am. Actually, day by day, we are enjoying this. Great effort you have taken and enlighten us, and it is quite helpful for us to improve our knowledge, ma'am. Thank you, ma'am.
Good evening, madam.
Good evening, ma'am. Good evening,
Yes,
ma'am.
ma'am. Good evening, ma'am. Yes, ma'am. Yes, please. Hamida, ma'am. Good evening, ma'am.
Yes, ma'am. Yes, ma'am. First of all, I am very thankful to you for giving me the opportunity to say something about the FDP. I am also thankful to the entire organizing team to organize such a wonderful course. And then I would like to congratulate you, ma'am, for the successful completion of this FDP. And during these days, almost every day we have two resource persons, one national, one international from USA, UK. Today is also from Malaysia. And the resource persons were actually resourceful persons, ma'am. They were responsible. They delivered insightful presentations on various multidisciplinary topics such as teaching, innovation, and educational technology integration, digital ethics and responsible teaching, data analysis using the movie, or interpersonal relationship, communication skill, teamwork, classroom management, integrated curriculum, or something like that. So it was a wonderful experience. The knowledge which we have acquired from this FDP, ma'am, we will apply in teaching learning environment as well as our day-to-day life. I would like to especially mention you ma'am, Dr. Aruna ma'am and Dr. Gayatri ma'am. They were with us almost every day from the very beginning to the end of every session, which really encouraged us to stay active during the session. And hence we enjoyed a lot. So thank you everyone. Thank you so much, Dr. Aruna ma'am, Dr. Gayatri ma'am. Thank you. Thank you.
Thank you, ma'am. Thank you, Dr. Hamida, ma'am. Anyone else wish to speak a few words?
Madam, good evening, ma'am.
Good evening, sir. Good evening, sir.
Madam, I am Dr. Krishna, madam, working as assistant professor, Department of Marine Biology, Vikram Singapore University, ma'am.
Yes,
Madam,
sir.
I am very thankful to you, ma'am. Thanks for this training, especially this program. All programs very well. They're designed and they are well trained, ma'am. As it was very informative and as well as it can be very helpful to all candidates. I truly appreciate your guidance, ma'am, and support throughout the session, ma'am. Hello.
Thank you, sir. Thank you, sir. Thank you so much. Actually, your interest matters, sir. So without participants, we cannot do anything. So yeah, all of you are this much enthusiastic and this much interestingly participating all the day. I could see Dr. Hamida ma'am every day, and you also, and Dr. Deborah ma'am, Gopika ma'am, Dr. Devjit Datta sir, Dr. Kumar Gaurav sir. So in spite of all your busy schedules, you are very much interested to listen all the speeches here over. So that's why this matters a lot for us to encourage us, sir, and to do more and more things in future also. Thank you so much, sir. Thank you.
Thank you, ma'am. Thank you.
Anybody else wish to interact?
May I?
Good evening, ma'am.
Good
Myself.
evening. Yes, ma'am.
Good evening, ma'am.
First of all, I would like to thank you all for organizing such a wonderful FDP. FDP was highly informative and enriching. All the sessions, they provide valuable insights regarding the interdisciplinary approaches in the education. All the resource persons explain concepts clearly and make this learning experience engaging and more effective. All the sessions are interactive, and whatever discussions they encourage thinking and collaborative learning. Overall, the FDP was very well organized. I'm very much thankful to you, Aruna ma'am, and also all your team for such a meaningful program. Thank you. Thank you.
Thank you, ma'am. Thank you so much, ma'am. Thank you. Thank you. You also daily very actively participated, ma'am. Thanks a lot for your active participation and your cooperation, ma'am. Thanks a
Thank
lot,
you,
ma'am.
ma'am.
Thank you. I would like to have all of you in our each and every program conducted in future, and I wish all of you also as speakers and as resource persons in all our coming events. Actually, this is my main motto behind collaborating with all of you. Like we are all must share all our knowledge to each and every person and each and every corner of India and abroad also. This is the main motto of actually establishing this organization, ma'am.
Good evening, madam.
Good evening, ma'am. Good evening.
Madam, this is a very wonderful 15 days, 2 weeks national FDP program. And this program covered all nowadays, madam, cyber security, health and hygiene, and AI tools. In all sectors, you covered, and I especially express my grateful thanks to you, organized in such a manner. The international and national speakers, they are all did very well and participated. Enjoyed all the topics, whatever, and especially my thanks to Sidvi madam also. It's a wonderful opportunity as a part of this, and I am very thankful to Sidvi. Thank you so much for giving this. Thank you, madam.
Thank you, ma'am. Thank you. It means a lot for me, ma'am. Yes, ma'am. Yes, ma'am. Yes, Rajni, ma'am. Thank you so much, ma'am. It means a lot for me. This feedback will boost me more and more to come out, ma'am. Many more emoluments to come out from Sidvi Foundation. Thank you, ma'am. Thank you.
Ma'am, on request, ma'am.
Yes,
Arna
ma'am. Yes,
ma'am.
ma'am. Yes, ma'am. Yes,
You
ma'am.
are having so many resourceful person, national and international speakers. We would like to also use some of your persons in our institution, ma'am, for conferences and workshops.
Definitely, ma'am. Definitely, ma'am. Definitely. Definitely will
Okay.
arrange. Definitely will
Okay.
arrange.
Thank you so much, ma'am.
Thank you, ma'am. Thank you. Gopika, ma'am. Dr. Gopika, ma'am.
Ma'am, thank you, ma'am. Thank you for all this wonderful session and insightful one. It was really informative, engaging, and inspiring. Also, all the speakers presented the topic very easy, and it was interesting for everyone. And the effort and knowledge, also the interaction with the audience, made the session very effective and memorable. Sincerely appreciating the time and dedication for the organizers to conduct the session. Also, definitely motivated us and given us a valuable knowledge in different perspectives. Thank you. Thank you very much, ma'am.
Thank you, Dr. Gopika, ma'am. Thank you. Thanks a lot, ma'am, for your valuable feedback and your interest also. Daily, I could see in you in your FDP, ma'am. Thank you so much. Thank you.
Thank you.
Anybody else wish to speak?
Yes, ma'am. I would also want to say a few words, not taking much of time because everyone is saying something. So I thought even I too should make my words clear. So
Yes.
why do we actually do these FDPs? We all know it's not just for that our continuous assessment process, but even to easily get to know more about what is easily in a way I should say getting so many knowledgeable, highly knowledgeable people, intellectuals under one roof, and we getting that knowledge share is not an easy thing, first thing, and it's not possible in such a short period of time if we get into doing it by ourselves. So the best part that you did is bringing everybody under one roof, and we all just joining in made our things much more easier and comfortable. This is what I can say. And moving into the kind of knowledge share that happened, it's like a total multidisciplinary. You went into multidimensional, multidisciplinary, multifaceted, and people from medicine, people from engineering, people from biology, people from arts, people from social sciences, each and every one coming here on this platform and sharing their expert views or their knowledge to all of us really means a big thing for most of us sitting over here, because we all want to gain knowledge and use it. One ma'am said that very nicely, that we got to know how to use this knowledge and implement it. Yeah, execution is also very important. Getting knowledge is one side, and implementing it in our side, in our own endeavors, while meeting students, while talking to them, while sharing knowledge. How do we impart the same things that we are learning? Implementing that has really been made possible because of this kind of an FDP that has brought so many of us together. Lastly, just like how one ma'am said that she wants to share, she wants you to share such experts' knowledge contacts so that they too can use that. This is really a very nice one. See how, what a nice thing that people have understood that, okay, if I want this knowledge, then I have someone like Aruna ma'am who can share a contact, who can refer someone to us. So this is the way that we all network, and this is the way that great things happen. Unless and until a visionary like you do these kind of activities, people will not follow what is happening in today's times. Thank you so much for providing all of us such a wonderful sessions every day, and bringing us all together. Yeah, now we know so many people. Before this, we knew many, but now we know so many. That is another good thing that has happened in these 15 days. Thank you once again, ma'am. Thank you so much.
Thank you, ma'am. Thank you, ma'am. Actually, I would like to say one thing, that you are the heart of this FDP, ma'am, because without you, I cannot imagine this much fruitfulness of this FDP, ma'am.
No,
While
ma'am.
while I am in very hectic schedules and very like unavoidable conditions of mine, you had taken part of this thing, and you had successfully this FDP, ma'am. That is what I would like to convey my heartfelt thanks, first of all, to Dr. Gayatri, ma'am, who
Thank you,
has
ma'am. My pleasure.
taken a very active part. That's why you are the heart of this FDP, ma'am.
No,
Thank
ma'am. My pleasure. Always. Listening to such great people is also a very big thing for all of us. Otherwise, how do we get the chance? Otherwise, how will I know that someone from medical background is also using multidisciplinarity? It is not at all possible, whether AI generative or even otherwise also. It is not so
Yes.
easy for all of us in our own places, in our own domains. Knowing more is equally important than that is knowing someone from other domains also who they are doing. So similar knowledge, similar share is also an important part. Thank you so much, ma'am.
Thank you, ma'am. Thank you, ma'am. And another one thing I would like to convey, that what exactly Deborah ma'am said and Dr. Gayatri ma'am said is aptly true, ma'am. Exactly, because when I think of any state or any city, ma'am, immediately I could remember any persons from our team. Say suppose we are having from Kashmir to Kanyakumari. If I remember or if I have any work at Kashmir, immediately Dr. Shamim Akhtar ma'am will be in my mind. Likewise, in Tamil Nadu, many people are there. In West Bengal, many people are there. Likewise, all the states we are having many collaborators, ma'am. That's what Sidvi had given me a chance to meet all over India, ma'am. This is incredible India, also we can say. So this is what I got from establishing the great platform of Sidvi Foundation. So this is my pleasure and God's wish, ma'am. Thanks a lot, all of you. encouraging me in such a manner that day by day, Sidvi is getting many more new members are adding, and many new things are being conducted from on this platform. This is what I would like to express on this platform. And one For a while, for 1 or 2 minutes, I would like to have any suggestions also. Any lapses or any suggestions also, so that we can move for the valedictory. Anybody would like to give any suggestions to be implemented in future of our events?
Ma'am.
Hello. Hello.
Yes, ma'am. Yes, ma'am. Yes, ma'am.
Hello, ma'am.
Yes, ma'am. Yes, ma'am.
I'm Dr. Manisha Khutwad. I would like to thank you and Sidvi Foundation for such an insightful FDP, which will help us in our future journey. And I also like to suggest that the FDP should be in such a manner that a hands-on training or something like that should be organized so that it will help us in our future, like AI tools and all. We should be use while learning so that it will help us in our future.
Definitely, ma'am. Definitely, I'll be noting this point, and we'll make possible in a very near future. Not 15 days like that. We can arrange in 1 week or 3 days or 4 days to make utilization of all the tools and all the hands-on training programs, ma'am. Definitely, I'll do that, ma'am. Thank you so much.
Okay, thank you, ma'am.
Thank you.
Ma'am.
Thank you. Yes, ma'am.
Ma'am, just a doubt, ma'am. All the sessions were live streamed, no, in YouTube?
Yes, ma'am. That's what I would like to announce, that all these sessions are there in YouTube. I request all of you to please subscribe Sidvi Foundation YouTube channel so that you can have notifications also. So all our previous events and previous talks also you can view, ma'am. You can
Okay,
watch.
so these sessions in the 2-week program, everything is recorded in the YouTube, no? Your
Yes,
channel.
ma'am. Yes, ma'am. Yes,
Okay,
ma'am.
okay. Just to clear that down. Thank you, ma'am.
Yes, ma'am. Yes, ma'am. And one more request from my side is what exactly Dr. Gayatri ma'am said, that you please try to explore these Sidvi Foundation events to all your known contacts to make utilization by them also. Thereby, Sidvi also can be fruitfully can organize many more events in coming near future.
Since you asked for a suggestion, I am not so big enough to suggest or maybe tell you something like this, but just because on a very friendly note, I can say, though we are in this digital era, technologically aiming for high, but surely not only in social sciences, but even in other basic sciences as well. That means like physics, or maybe like so pure I'm talking about, and even some subjects like history, some subjects like political science, like political administration, or public policy or governance. These are the subjects that the students who are Gen Z, yeah, they may not be that much keen in understanding them. But so if faculty like us who's teaching such Gen Z generation, if we are able to give them that little insights through our teaching in some way or the other, and how do we get that little knowledge that that is provided through these FDPs or maybe some conferences. So all I want to say is, maybe if you can incorporate these subjects also, the basic subjects, which are very much important for us to know our past, to move into the future with the present that we have. And I think we can next time onwards, maybe sometime later, if you can plan for such kind of a conference, maybe a 2-day or a 1-day conference also, but keeping these subjects in your view, so that we can have a such kind of a knowledge share also happening.
Definitely, ma'am. Definitely. Actually, in all our many people had asked me that why you are always not confined to one subject. You are organizing multidisciplinary like that. So all our previous events, most of our previous events are multidisciplinary and multidimensional, ma'am. In that, we are making a note that not limited to. So we are giving some domains, all the domains we are giving, and at last we are giving a note that not limited to means it will be open to all the subjects, ma'am. Whatever the educational domains are there, those can be come under, including arts also. Arts means like theater arts, like that, ma'am. So you know very well, Dr. Injim ma'am from Assam, her 10-year-old boy had played drums in one event. So likewise, like these all dancing and singing and playing some drums or some pianos like that. That also we are encouraging in our all events, ma'am. So we are not only stipulated to some areas, but it is open to all areas of education, ma'am.
Yeah, yeah. You remember Santrupti Das on the third day we had her session also. She too can give a workshop on what she does, the paper folding origami. One day we
Yeah.
can have such kind of a session also. That will be very much of an interest for someone
Yes.
who wants to explore in those areas, and even it can be for students as well, for not only for faculty.
Yes, ma'am. Definitely,
And
definitely.
if you say liberal arts and all, then we have so many people coming in from history. We have someone coming in from political science background. We can have someone. So it's like having not only one-sided but multidisciplinary. So we can have transdisciplinary next time.
Definitely, ma'am. Definitely, I'll do that, ma'am.
Thank you so much.
And I have one more vision to organize that Agnihotra also. Actually, I had planned to organize offline by inviting Dr. Kirti ma'am to Visakhapatnam one time. At that time, actually, it was missed. I don't know why. Sidvi is concentrating on health aspects also, health consciousness also, ma'am. So that's why Sidvi is going in the form of the research of like some societally useful productive works of sustainable good production, like biodegradable sanitary napkin pads which are free from dioxins. Likewise, some sustainable good production development also Sidvi is going to do, ma'am. And one more research is going by the team of Sidvi that we are about to make paper bottles. So instead of using plastic water bottles, we are making research on some paper bottles. Maybe in a very few days, we can come forward with that invention also, ma'am. So likewise, Sidvi is providing a platform to all researchers, academicians, and students also to share their ideas on this platform and to do some work also. So I myself had encouraged some of my students who are interested to do this research, and we got succeeded, ma'am. Very near future, we may come out with the paper bottles.
Okay, ma'am.
Yeah. Thanks a lot, ma'am. Thanks a lot. And as you said, we'll concentrate on this history, public administration, politics, like social sciences and journalism also, ma'am. So we'll concentrate and we'll make exclusive of some social sciences event also in coming near future.
Yes, ma'am. Yeah, true. Thank you.
Thank you, ma'am. Thank you so much. I would like to convey my heartfelt thanks to each and everybody, name by name, who had made this wonderful event a grand success. And I would like to say my heartfelt thanks to my jury members and the team Sidvi Foundation and President SSRD, Joint Secretary, Executive members of SSRD. To accept my proposal to organize a 2-week international FDP program. And I would like to convey my heartfelt thanks to the heart of this FDP, Dr. Gayatri Indrakanti ma'am, who had paid a lot of efforts on this to make this grand success. Thanks a lot, Dr. Gayatri ma'am. And afterwards, I would like to convey my heartfelt thanks to my brother, Dr. Vamsidhar sir, who had given very good speakers to this platform. And he also as a part of, as a distinguished speaker of this FDP. Thanks a lot, Dr. Vamsidhar sir. And I would like to convey my heartfelt thanks to all my friends who had encouraged me and they had registered and they had participated very actively each and every day. I would like to convey my heartfelt thanks. And first of all, I would like to revise these speakers to say my thanks. Dr. Anya Lampo ma'am from Greece and Dr. Kesari Kirti ma'am from Bangalore and Dr. Srikar Hari, Mr. Srikar Hari from USA and Santrupti Das from USA and Vijay Chandra from Andhra Pradesh and Dr. Santosh sir from New Delhi and Prakash Rao Kollaram sir from USA, Dr. Dixon Adam sir from Ghana, Dr. Abhishek sir from Bangalore and Dr. K. Vijay Krishna sir from Visakhapatnam, Andhra Pradesh, Dr. Kaustubh Kumar Shukla sir from Greater Noida, Uttar Pradesh, Dr. Aruna myself, and Dr. Dhanushkodi Rangaswamy sir from Malaysia, Dr. Vamsidhar Annam sir from Bangalore, and Mr. Mohan sir from Visakhapatnam, and Dr. Christopher sir from Ghana, Dr. Karthikeyan sir from Tamil Nadu, and Professor Purushottam sir from Malaysia, and Dr. Suresh sir from Maharashtra, and Miss Mahalakshmi ma'am from Tamil Nadu for sparing their valuable time and giving their valuable speeches over here to enlighten all of us. So thank you so much, one and all. And I would like to say my heartfelt thanks to each and everybody who had paved a very good pavement to this successful conduction of this program. Thanks a lot, one and all. And I would like to say, I would like to conclude this event with our national anthem. And I request all of you to please join your tones to sing the national anthem. I request all of you to please unmute and start singing national anthem. By standing in front of your devices. Yes, start. Janagana Manadinayaka Jaya He Bharat
Bhagya Vidhata
Punjab Sindhu Gujarat Maratha Dravida Utkala Ganga Jai Himachal
Yamuna Ganga Jaya Jaya Ganga तव शुभ नामे जागे तव आशीष मांगे
गाहे तव जय गाथा
जय हे भारत भाग्य विधाता
जय हे Jai Hind.
Jai Hind.
And I'm happy to announce that all of you will get start getting your certificates from this night onwards within a couple of days. If in case any delay in the mail sending, I'll be sending you through WhatsApp also. So all of your certificates have been ready, and I'll be sending to starting from this night. Thanks a lot. Thank you. Have a great day. And I wish to see all of you in our coming future events. Thanks a lot. Thank you.
Thank you, madam.
Thank you so much.
Good night, ma'am. Good night.
Good night.
Good night, ma'am.
Officially, I'm ending this meeting now, ma'am.
Thank you.
Thank you, ma'am. Thank you.